Roll call. Thank you.
Ramon Rubacava,
Present.
Jose Luis Pacheco,
Present.
Controller Malia Cohen, David Miller,
Here.
Marina Ortega, Kevin Palke,
Morning.
Teresa Taylor,
Here.
Yvonne Walker,
Here.
Melissa Willett.
Here.
Thank you. And then the next order of business is we recess now into closed sessions for items 1 through 4 from the closed session agenda. So thank you for bearing with us. And for the record, we have Ms.
Evans.
Ms. Evans? Ms. Evans for Controller Cohen.
Thank you.
In open session, and we'll continue with the remainder of the open session agenda. Please call the roll.
Needs to be roll call. Ramon Rubacaba,
Present.
Jose Luis Pacheco,
Present.
Regina Evans, David Miller,
Here.
Lorena Ortega, Kevin Palke, Teresa Taylor, Yvonne Walker,
Here.
Melissa Willett.
Okay, thank you. Now we'll proceed with the next agenda item, with the executive report. Mr. Moltz or Kim. Sorry, Kim Moltz.
I'm going to go ahead and start. Good morning, Kim Malm, CalPERS team member. I'm just going to take a few minutes today to give you an update on our final PPI breach statistics, our retiree warrant project, and our next CB. Let me start with the PPI breach statistics. I don't know why that's such a hard word for me to say. As you're aware, on September 30th, we ended the registrations for the 2-year credit monitoring. These are the final numbers. Since June, we answered over 16,000 emails from our members in the PPI mailbox. Our CalPERS call center received almost 7,800 calls and also over 1,500 secure Ask My CalPERS questions. Our regional offices had over 400 inquiries. Experian received almost 76,000 calls, and most importantly, we had over 204,000 members retirees register for credit monitoring. And that's almost 20 or over 26%, which is a fantastic number considering 4 to 6% is the typical average when Social Security number is breached. We've confirmed that there's been over 1,000 organizations and 60 million people around the world have been impacted by this breach. And as I stated in September, I'm very thankful for all the support and assistance we have received from the entire CalPERS team and our retirees. Moving on to retiree warrants, as I mentioned in September, we rolled out the interactive voice response, IVR, or phone system, which allows retirees to check their warrant amount, including details like itemized gross amounts and deductions. They do this by calling 1-888-CalPERS. This became active on October 1st. So in the last 1.5 months, we've had over 700 people successfully call and listen to their warrant information. There have been some that have failed to validate. Mostly these are people that have no warrants in the system, as they're active or they're inactive or they have a paper warrant. In addition to the IVR option, a link is being developed that will allow the retiree to see their warrant within My CalPERS at the click of a button. This new functionality incorporates a secure authentication method that requires members to input their My CalPERS login and password, and then they will put in a code for multi-factor authentication. This ensures the protection of their personal information. Once authenticated, members can immediately see the retirement check details, and they can scroll down also for previous month's warrants. This functionality will begin in January. Previously, we believed that there would be a monthly push of information to a retiree's phone or email And however, with additional advice from our Information Security Office, in order to prevent phishing schemes to our retirees, we'll be sending one email out to all of the retirees who we have email on file and notifying them that this option is available. We'll also provide instructions on how to save the link on their desktop or phone, and we'll follow up with an article in our perspective and a banner on our webpage. We believe these new options will provide greater convenience for our members in a secure environment. Lastly, as a reminder, our next CB or CalPERS benefit education event will be December 5th and 6th, and it'll be virtual. We typically have about 3,200 people participate when we have a virtual CB. I'd like to thank board members Melissa Willett and Kevin Palke, who went to the Glendale Regional Office after our last Ed Forum, and they got a tour of the office, and they got to, I think, watch, Ms. Willett got to watch a counseling session. They met the team members, and the team is always very thrilled when they have visits from the board members, so thank you very much for taking the time to do that. And with that, I'll turn it over to Don.
Thank you.
Go ahead.
Go ahead, Don.
Great, thanks. Good morning, Mr. Chair, members of the committee. Don Molds, Chief Health Director. I want to begin with a couple of updates before we dive into the agenda. We completed another successful open enrollment. The final report with detailed migration information will be available for the March committee meeting. We added capability to our tools so members could search for their medical group, doctors, and behavioral health providers. We strongly encourage members to shop and compare health plans through our custom letters, and we saw a 47% increase in health open enrollment transactions compared to this time last year. We continuously look for opportunities to enhance our tools, to improve our members' experience and help them make informed choices. Next year, we're adding additional functionality for retirees to manage their health benefits in My CalPERS, like making health and dental plan changes outside of open enrollment with specific qualifying events. I want to thank the folks on my team who do such a great job managing this process and assisting our members and employers during this busy time. And I also want to thank the folks on Kim's team who do an outstanding job serving our members through the call center. Next on the agenda today, I'd like to draw your attention to item 4C, our health benefits annual report for the 2022 plan year. The report provides information about our health benefits program, including our health plan portfolio, financial information, and other relevant data and trends. Highlights include the news that we spent $10.6 billion providing health care for our members, and that on average they paid $309 out of pocket for medical care and prescription drugs. We hope you find the annual report a good resource. It's a big effort to prepare, and I'd like to thank our team and the many team members across the enterprise who contribute to its development and delivery annually. Finally, also on the agenda, we'll ask for your action on the long-term care request for a proposal and the health program proposals for the 2025 plan year. We'll also unveil plans for the health policy forum. I can stop there and see if there are any questions.
Thank you. We do have a question from Trustee Willett. Ms. Willett.
Thank you so much. Thank you. I just want to give a quick update. First, I had a phenomenal time and thoroughly enjoyed meeting the team at the Glendale office. So thank you for that. And I just want to pass on that I also recently had the privilege of talking with Public Works members at the city of Palo Alto. They made sure to tell me that they use the CalPERS call center really regularly, and they're delighted and grateful for the stellar service that they get every single time. They said they know they get different people, but the lady that answers the phone, whoever she is every time, is super nice, and she is super helpful. So thank you so much, and that's feedback from our Public Works workers. Thank you.
Thank you. And we also have Mr. Pacheco, followed by Ms. Palke. Mr. Palke.
Yes. Thank you, Don, and thank you, Ms. Mo, for your information. My question is back to the warrant checks. You mentioned that about 700 people have already started utilizing it as of today. Is that from how many months now has it been in effect?
It's October 1st, so about a month and a half. There's been over 720 as of this morning.
Has there been any I mean, just technically, has there been any problems? I mean, is it easy for the members to, the retirees to activate it and get the information?
We have not heard any problems. We have some of our retirees in the back of the room that I know have used it and have done so successfully and have said it was easy for them
Oh, wonderful.
to use. So,
And the other concern I have is just making sure that you said there was some security parameters around the credentials, two-factor authentication. Is that the only security, or would there be more enhanced security because of all these all the data out there?
so on the link that's going to be provided, they're going to be basically logging into my CalPERS. So they'll be putting in their login and their password to log into my CalPERS, and then they'll get a multi-factor authentication code sent to them that they will have to put in order to be able to go into my CalPERS and access their information.
Oh, I see.
But they won't have to navigate through it. It will come up immediately. The paycheck information, the warrant information will come up immediately after they do the multi-factor authentication.
And they have to do that multi-factor authentication
Every time.
so it makes sure that it's them. It's not
that's correct.
some bad actor, right?
That's correct. Do you want to
Okay,
add something?
excellent then. And that.
Yep. Oh, yep.
And also just the last question on this information, is it out there already in our website so people can have other instructions of how to dial in and follow through all the things out there on our website?
Yes, there's information on the website on how to do the phone call.
Okay, fantastic then. That'd be wonderful. If perhaps, do we have that out there? Can we request that? Can we request that information so that make sure that we have it so we can share it with our
Absolutely.
members? That'd be awesome. Thank you so much.
Thank you, Mr. Pacheco. Karen?
Yeah, thank you. I just want to say thank you to David and everybody at the Glendale office. It was an absolute privilege to see the passion in our staff and watching them interact with our members. It's good to know that we have hired the right people for the right job. And it was just an absolute honor to watch them work and to see them excited about their work. So thank you.
Next item, which is I'm sorry, did I miss somebody? Oh, there you are, Miss Walker. Please, apologize here, I didn't see you.
Thank you, Mr. Chair. So I just wanted to say I found it kind of ironic. I learned this month that as part of that breach that we had here, it also impacted my healthcare company and my mortgage company. So I was like, oh, 3 times. I'm the trifecta. I'm the winner. And then I just wanted to give a shout out for the process of being able to go in, look at as you're going through open enrollment and look to see how everybody's covered and everything else. I had a minor panic period thinking that one of my doctors wasn't covered, and it was resolved quickly. Took the stress away. That was one of the best things that I think that we've done. So congrats to the team and everybody.
And it's moved by Mr. Pacheco and second by Mr. Miller. And we'll proceed now to the, we need a vote? Yes. So we shall do a vote. Okay, all in favor, please? Aye. I think we have the votes there. Thank you. Now we'll move on to number 4, information consent items.
Excuse me, Mr. Rubalcaba?
Yes.
You need to just check if there are no votes and abstentions before
Okay,
you announce the
thank
result
you.
of the motion.
So we had the yes votes, any no votes? Any abstentions? This is on the action consent items. And I think we only have yes votes. Thank you. Now we'll proceed to the information consent items. Nothing pulled, but we do have public comment. Mr. Tim Burns, please come to the front.
Chairman Rubikova, members of the committee, back to speak about Delta Dental again. There's been a lot of outreach by other retiree groups since I talked about Delta Dental the last board meeting and committee meetings we had. All of them are united in being dissatisfied with Delta Dental. I would urge the CalPERS health team to explore the feasibility to provide and sell alternate dental insurance. If we can't get rid of Delta Dental or have it come back to CalPERS administratively, then it would be nice if stakeholders had an alternate ability to purchase additional dental services. I met with a retired dentist last week, 2 weeks ago, who was formerly working in the Delta Dental family, and he quit. And his reason for quitting is Delta Dental has cut their dentist to $1,000 per patient per year reimbursement. And he said, I can't even do a crown for that anymore. So the dentists continue to drop out. There continues to be very difficult to have services or find them, especially in small towns like I live. So there needs to be something done about Delta Dental. I know that at least 2 of the bargaining units, 5 and 6, I believe, have their own dental insurance. And if it's possible for CalPERS to find out what those insurances are and why they chose to have their own insurance for their unions as opposed to the Delta Dental or in addition to the Delta Dental, then that's something that we would like to see happen for our stakeholders too in the future. I think that's probably all I have to say, but I do want you to know that there is a movement starting out there of retiree groups, and actually the labor organization of the CAL FIRE leadership is also going to bring this up as an issue with the active employees that they represent in CAL FIRES. Thank you very much.
Thank you for bringing this to our attention. Okay, now we proceed to action agenda items, starting with 5A, the long-term care request for proposal. Mr. Modes.
Great, thank you, Mr. Chair. Before you is an action to item to approve an extension of the current long-term care program third-party administrator contract with Illumifin, formerly the Long-Term Care Group, for up to 24 months. The current contract expires at the end of 2024. 24 months gives us the amount of additional time we need to run a full solicitation for the next long-term care program administrator and, if necessary, to transition the business to a new administrator. Specifically, we anticipate that it will take about a year for the solicitation and then 18 to 24 months to transition the business to a new administrator if one is selected. In the event that we don't select a new administrator, we would kick that timeline up considerably, potentially limiting it to the 1 year. If approved, this would be the second 2-year extension for Illumifin. We moved forward with the solicitation on a very similar timeline about 1.5 years ago, but pulled it back shortly after settlement in the wedding lawsuit. As we shared with you at that time, it would have been extremely problematic to administer the settlement at the same time we transition the program to a new vendor. Happy to answer any questions.
Any questions from the committee? We have Ms. Taylor. President Taylor, please proceed.
Oh, thank you very much, Mr. Rublikova. So we're approving a 1 + 1 + 5 year extension?
So you approved that previously, okay. And this is an extension of the existing contract.
It's not worded like that, though. Oh, the 1 + 1 terms would allow for.
Yeah.
Okay.
The new contract contract would be the 5 plus 1 plus 1 that you had approved in the previous discussion, which was the year and a half ago. So this is just the 24-month extension of the existing contract.
Got it. Okay, so we're already 2 years out from the 5 years. And now is that it?
We are currently on a 24-month extension, a year into a 24-month, more or less a year into a 24-month extension. We need another 24-month extension to run the contract, to run the procurement, which we have to start all over again, and then we need an additional 18 to 24 months to transition the business to a new vendor if one is chosen. If we do not choose a new vendor, we would not need that additional 18 to 24 months.
Got it. So essentially, we had to stop it because the wedding settlement. So we stopped.
We canceled the solicitation.
Right. So then we were just still with Illumifin.
Correct.
So now we're going to try to do a solicitation, and that's the 2 years, 24 months.
So the solicitation takes about a year. We'll be starting that almost immediately. But then we will need the additional time on top of that for the transition.
And what are the chances that somebody else wants to take this long-term care plan?
I think high.
Oh, okay.
I think there will be. I think that we are likely to see competition for our business.
Okay.
Particularly now that we are
settled
through this lawsuit.
Okay.
Yeah.
All right. Thank you.
Yeah.
Thank you. And next we have Trustee Walker.
Hi, Don, I'm still confused. As I'm looking at the second paragraph, right, it reads to me that we're pre-approving once we do the 24-month thing.
So I'm not sure. Are you looking at the agenda item? Or?
I am. I'm looking at the recommendations under the agenda item. So the second paragraph seems like it's a pre-approval thing. I'm fine with the 24 months, but that paragraph,
yeah.
I'm not.
So I'm going to have Jared come in and you can use that one. Yep.
So there's two items here, right? So one of them is the new contract, which will be awarded by the RFP, by the solicitation. So that one has to have time baked into it for a transition if it goes to a new vendor. So that's the 1+1 aspects of that. So the new contract will be 5 years with 1+1 for additional, which is the additional time needed for transition. But we also need to have our existing vendor in place while transition is happening, right?
No, I understand that, but it just seems to me that this is like a pre-approve, like assuming that we're going to get a new contractor. This is a pre-approval of that new contractor without it coming back to the board. That's what it reads to me.
Yeah, so that is not what we're asking for.
I want to reword it.
That's what it reads.
Yeah, okay.
Or take that paragraph out, let's do it straight for the 2 years and then do something different for the other thing.
So all I'm asking for right now is the
it 2 years?
24-month extension.
Then we should take out that second paragraph because it's confusing.
Okay.
So I would move
but to clarify, what I am asking for right now is a 24-month extension on our existing contract and nothing more.
That's the third paragraph.
Yeah.
So I would move that we remove that second paragraph from the recommendations.
I think we do want to have clarity on our action. So, well, if that's the way to do it, go through the motion, yes, we'll do that. But before we vote, I think we have public comment though. But I just want to make sure we're okay on
By the way.
Second by Ms. Taylor, thank you. So we have that,
Yeah, it does.
Okay.
But I think we need some clarification from staff though, okay? Don,
can I clarify? Sorry, apologies. This is so we are asking for two things. One is the 24-month extension, and the other one is for approval to go out to bid on the contract on the existing book of business.
So it's a solicitation.
So it's.
That's not what it says.
There you go.
So we're asking for, so with the ask to go out to solicitation, it's we're also specifying what the term of that contract would be. So we're saying we want to do a solicitation for a contract that is a 1+1+5.
So, I understand what you're telling me. That is not what I'm reading this to say.
Okay, so we can.
Well, we can look at, if we look at the recommendation in the front page, the front cover page,
I'm looking at the
there's 3
recommendation.
approvals.
So I think, I think what we should do here is we can just pull the approval of the 1+1+5, which is the one that is causing the confusion, because what we need here is the approval to go out for bid and the approval of the 24 months. So that is what we are asking for.
Okay, so then it makes sense to accept the Ms. Walker's motion is to delete the second paragraph, that's correct? Which was second by Ms. Taylor, and I think we will do that.
Well, no, because now we're being told they need
Do you need the second? No, you need the first and third paragraph, correct?
The first and the recommend, under recommendations, there is approve the release of a long-term care program TPA solicitation. We are asking for that. We are not asking for the approval of a 1+1+5-year contract term.
Okay, so we do want to take that out.
Because you have previously approved that model.
So we approved the third paragraph, which is the up to 24 months extension of the current contract.
And then the third one, we are asking for the extension of 2 years of the existing contract.
Correct. I think we are clear here.
Sorry for that.
Okay, so.
So the motion is to remove the second paragraph and pass the remaining 2 paragraphs.
And
Correct.
I think the suggestion was that you do that as 2 separate, to keep it clean, as 2 separate actions.
Okay, so what we're calling for the first motion right now is approve the release of a long-term care program third-party administrator solicitation. Do I have a motion?
Wait.
We're going to break it up.
Right, no, but hold on. The only thing we're breaking up is we're removing the middle paragraph. So that's your first motion. Your second motion, you can approve both of the remainder. As amended.
Okay, we were going a different path, but that's fine. So we're going to first vote to remove the second paragraph, which was a motion from Ms. Walker. And second by Person Taylor.
Okay.
Okay, that's the clarification.
We're throwing this into
Well, let's wait till staff weighs in here.
I don't think you have to pay attention to the way the agenda item is currently written and say, I want to remove this part of the recommendation. I think for the record is to be very specific about what you are approving. So I would do them in 2 separate motions. Motion 1 is to approve the extension. And then motion 2 would be to, if you're in agreement, to move forward with the solicitation itself. But I wouldn't get too hung up on the way the agenda item is actually written. I would just keep the motions very clear, and we'll have it on the record.
Okay.
Thank you.
Can I, with apologies, add to the soup a little bit here? Okay. All right.
We're going to go first, so we're going to follow our CEO's guidance. First, we have a motion to extend the current long-term care TPA contract for an additional up to 24 months. And Mr. Pacheco, Commissioner Pacheco makes that motion. Do I have a second? Mr. Commissioner Miller makes the second. Can we vote on that, please? Everybody say aye.
Go ahead and get public comment. So
yes.
Take your motion and your second, and then ask for public
Okay,
comment.
we'll have
on
public
each.
comment now. Thank you. Ms. Marcy Brown, please. Yes, please.
My comment is not actually on the proposal, so I don't think you need to wait for it to take your vote. I did want to make a comment on the long-term care
Please.
program generally.
Please proceed.
All right, so as a state retiree and long-term care policy holder, I am grateful for CalPERS, both the board and the staff, for all you do for managing our pensions and our health benefits, full stop. But I was very disappointed to learn as part of the long-term care wedding lawsuit of decisions that were made by this committee, likely your predecessors, not you, about how to distribute pension increases when you do have to do them. And particularly the hit that us long-term care policy holders who paid for inflation protection took, not only the hit that other people took, but took a larger hit. And that was very disconcerting. And I am asking to have to know how we can see those decisions be made on future increases. So is that done in open committee? Is it done in closed committee? How do we know that how those decisions are made so that we can weigh in if it seems like there's groups that are getting disproportionately hit, particularly after paying for decades for inflation protection, and then potentially being at risk of being priced out of these programs that we're using to try to protect our families from our long-term care health costs. So I'm asking to see how we can see the math before you make decisions on premium increases going forward. And I'm also asking to know how we will see the distribution of any wedding settlement costs distributed, because some of us, like myself and others who are very concerned about having long-term care, we opted to stay in. There's a huge payment out to people who left. It should not be that those of us who stayed in the program should be bearing the cost of those people who are leaving. So those are my questions and my comment. Thank you for your time.
Thank you. I think staff will be able to talk to you afterwards. Thank you. Okay, now we have the motion on the floor, so now we can vote. And the motion is for the 2-year, up to 24 months extension for the current TPA contract. So can we do everybody vote in favor?
Aye.
Aye. Any opposed? Any abstentions? The motion passes. Okay, now I'll entertain the motion to approve the release of a long-term care TPA solicitation. Mr. Miller makes a motion, approved by Kevin. Thank you. All those in favor, please speak. Aye. Aye. All those opposed? None. Any abstentions? The ayes have it, so we have the motion approved. So now we can proceed to the next item, which is the 5B, approve the health benefits program proposals.
Good morning, Mr. Chair, members of the committee. Rob Dorzambek, CalPERS team member. This is agenda item 5B, approval of the health benefit program proposals for the 2025 plan year. This is an action item. As quick background, in 2020, we implemented a formalized process to review proposals outside of the rate development process, or RDP. This separate process allows us to consider a variety of changes to our program for the upcoming plan year before any rate setting begins. This was done so that everybody knows what, if anything, is changing for the next plan year before any rates are developed. Potential changes include adding a new basic or Medicare plan, incorporating a new health benefit program, making a benefit design change, and lastly, adjusting a current plan's service area. Over the next few slides, I'll cover the timeline and walk through the service area expansion proposals. Then Dr. Logan will review the proposed benefit design changes, and I'll conclude with next steps. We solicited proposals from health plans in August and instructed them to address how their proposals support our strategic goal of exceptional health care. As a health team, we continually develop ways to further enhance our program through the benefits we offer. Our team has reviewed and analyzed the proposals and developed recommendations for you. If approved, these changes will be incorporated into the rate development process and will take effect on January 1st, 2025. To align with our strategic goal, we encourage plans to submit proposals that improve healthcare quality, increase equity, and maintain affordability. We also specifically asked the plans to provide proposals that improve access to care for members, especially in underserved areas lacking more affordable HMO options. Through the recent HMO solicitation, we made it clear to the plans that we expect them to continue to expand access of lower-cost HMOs to new areas. The plans listened, and we are pleased to share that each of our 4 lower-cost HMOs submitted proposals to expand into new areas in 2025, as did Kaiser. Over the next several slides, I will talk about the preliminary financial impacts to premiums. The impacts are based on each plan's best estimate, as well as our independent analysis. The final 2025 premiums could change depending on the results of the plans, provider contracting efforts in the expansion areas, as well as our continued analysis through the RDP process. Now I'll talk about each of the proposals, starting with Blue Shield. Blue Shield Trio is proposing an expansion into Contra Costa County. This covers the entire county. Trio is not currently offered in any Bay Area counties except Napa. Trio is also proposing a partial county expansion into 3 contiguous zip codes into Shasta County in the Redding area. Redding is the largest city in Shasta County, and these 3 zip codes cover almost 2/3 of all CalPERS members living in the county. If approved, the expansion would result in the first HMO plan available in Shasta County in recent memory. And this furthers our goal to improve access to more affordable HMO plan options in rural and low competition areas of the state. Currently, Blue Shield Access Plus EPO is offered in Shasta County along with the PPOs. We anticipate these expansions to have a minimal impact to premiums. The Department of Managed Healthcare, or DMHC, has already approved the Contra Costa expansion and is currently reviewing the Shasta expansion. We recommend approval of this proposal. Next is HealthNet. HealthNet is proposing to add Imperial County to the Saluda Moss service area. Imperial is situated right next to San Diego County on the U.S.-Mexico border. This would increase member access beyond their current footprint of the counties listed on the slide. The HMO plans currently offered in Imperial County are Anthem Select and Traditional plans, as well as Blue Shield Access Plus. We anticipate about a $4 impact to premiums, or roughly a 0.6% increase. The expansion is pending DMHC approval. We recommend approval of this expansion. Next is Kaiser. Kaiser is proposing to cover part of Monterey County for their basic plan. This would be in the cities of Salinas, Watsonville, and Monterey and the surrounding areas. This is all in the northern part of the county. The Permanente Medical Group doctors will provide primary care and some specialty care services, and they plan to establish contracts with select community providers to round out their network. At this point, the contracting effort with community providers is in the early stages and will be ongoing for the next few months. We expect minimal impact to premiums through this expansion. This expansion, of course, is also pending DMHC approval. We recommend approval of this expansion. Next is United Healthcare. UHC is proposing to expand Harmony into Contra Costa, Napa, and Solano counties. This continues their Northern California expansion, which includes Santa Clara and Santa Cruz counties for 2024. As you may recall, Harmony was previously a Southern California only plan, and as part of the HMO solicitation, we pushed them to expand north. UHC agreed to a multi-year and multi-county expansion plan with us, and 2025 will be the second year of that 5-year plan. UHC has already received DMHC approval for this expansion. We anticipate about a $20 impact to premiums, or just under a 2.5% increase. We recommend approval of this expansion. And last is Western Health Advantage. WHA is pursuing expansions in Fresno, Kings, and Madera counties, and is awaiting DMHC approval. WHA is in preliminary talks with a provider partner and cautioned that any proposed service area expansions are contingent upon successful provider contracting efforts. That said, they are hopeful to reach agreement in at least 2 counties, most likely Fresno and Madera, for 2025. We recommend approval of this expansion. I'll now turn it over to Dr. Logan to go over the benefit design proposals.
Thank you, Rob. Good morning, Mr. Chair and members of the committee. Julia Logan, CalPERS team member. Our team is excited to be bringing you 2 new benefits for 2025 that seek to improve health equity and health outcomes. We recommend these for your approval. First, we recommend implementing a new birthing doula benefit for all eligible basic HMO and PPO plan members in 2025. Doulas are non-clinical providers, meaning they're not doctors, they're not nurses, they are trained companions who support another individual through childbirth, providing advice, information, emotional support, and physical comfort. Doulas provide culturally competent care that supports the diversity of members before, during, and after childbirth, including support during miscarriage, stillbirth, and abortion, when our pregnant members may need this support the most. We recommend adding this benefit for several reasons. First, because they help prevent complications during childbirth. Doula care is associated with positive delivery outcomes, including reducing C-sections, use of epidurals, and premature deliveries, especially for members of races and ethnicities at a higher risk for pregnancy complications. Second, they provide much-needed emotional support, which lowers stress and anxiety, and provide increased empowerment and autonomy during the labor period, and improve breastfeeding success after delivery. Third, they drive cost savings, including reducing utilization of medically unnecessary C-sections. Lastly, and really important to all of us, is that doulas have been shown to decrease racial disparities in maternity care, disparities that have only grown larger as a result of the pandemic. In order to streamline the provision of the benefit, we intend to mirror the Department of Healthcare Services doula benefit structure wherever possible, including definitions of doula and doula services and doula minimum qualifications. Of note, California Assembly Bill 904 was recently signed and chaptered into law and will require health plans regulated by the Department of Managed Healthcare to develop a maternal and infant health equity program that addresses racial health disparities and maternal and infant health outcomes through the use of doulas by January 1st, 2025. Our proposed benefit is aligned with this new law and will apply to both HMO and PPO health plans. The projected premium impact of adding this new benefit for all basic members is 10 cents or 0.01%. Second, and next slide, please. We will also implement a standard travel benefit for certain medically necessary services. While several of our plans currently offer a travel benefit for some surgeries, not all plans do, nor is the benefit standardized across plans and services. To address this, we will standardize travel and lodging for certain medically necessary services, including but not limited to abortion services, gender-affirming care, complex surgeries, and cancer care that can't be accessed within 50 miles from the member's residence for all basic and Medicare members. Travel benefits encompass transportation, lodging, and meals for the member and companion, up to $5,000 per occurrence. For patients under the age of 18, we will cover travel for both parents or guardians as needed. This will support access and health equity by covering costs for members that may live far from high-quality, complex medical care or require specialized services unavailable locally, particularly for racial and ethnic groups that experience disparities in obtaining necessary care, and our LGBTQ+ members. The projected premium impact for the basic plans is 27 cents, or 0.03%. For the Medicare plans, it will be 54 cents, or 0.13%. I'll now hand it back to Rob.
All right, thank you, Julia. Here's a quick recap of the proposals we recommend for approval. Blue Shield Trio's expansion into Contra Costa and Shasta counties. HealthNet's Saluti Moss expansion into Imperial County. Kaiser's expansion into Northern Monterey County. UHC's Harmony expansion into Contra Costa, Napa, and Solano counties. And lastly, Western Health Advantage's expansion into Fresno, Madera, and Kings counties. And for benefit design changes, first, the doula benefit for pregnancies and postpartum care. And second, a standardized travel benefit for medically necessary care. Upon the committee's approval, we'll incorporate the approved changes into the rate development process and lay out the necessary implementation activities. We will communicate the plan expansions and benefit design changes to members in advance of and during open enrollment next year. We will present the 2025 health premiums to the board for final approval next July, with discussions about the initial and preliminary rates in the months leading up to that. This concludes our presentation, and we're happy to take any questions.
Thank you, Rob. We do have questions from Mr. Pacheco.
Yes, thank you, Dr. Logan, and thank you, Rob, for your comments here. I want to just, first of all, congratulate the team on this. This is a lot of hard work. I really appreciate it that from what I can tell, we are actually taking care of our folks in the more rural areas, which is really awesome, because from what I know, it's pretty incredible. It's an incredible part of our state. And I also want to appreciate the fact that you moving into Salinas and Watsonville and bringing in Kaiser. That is also great. I'm from that area. Was born in Watsonville, so I can tell you I was born in Watsonville Hospital, and the only hospital in town. So now people can have other options, and I think that's great. So I wanted to do that. Also wanted to just say about the DURA benefits. I think that's wonderful, providing that emotional support for the mothers or to-be mothers, and also for the travel benefits. So I just wanted to make those comments and appreciate that. And that's it. Thank you.
Thank you, Vice Chair Pacheco. Before I call for a motion on the approvals, we'll have public comment. Suzanne Paredes, please. Suzanne.
Hi, my name is Suzanne Paredes, and I'm the District Director for California State Retirees. My area includes Santa Cruz, Monterey, and San Benito counties. These are rural areas, as Mr. Pacheco just mentioned. Right now, we have 2 ongoing situations that impact our healthcare there. In San Benito County, Hazel Hawkins, which is the only hospital in that county, is now going through some kind of bankruptcy discussions, and I haven't seen anything that says anybody's coming in to save them yet, and that's a concern. And then we've had the ongoing issue at Salinas Valley Medical Center in Salinas, which is they've been without a contract since August. They continue negotiations, but I did notice in the paper the other day, it was mentioned that the CEO is now leaving, and now they have an interim CEO. So that to me kind of shows that there is more going on there than just trying to resolve this outstanding contract issue, which fortunately for many of our members does not affect Medicare Advantage, but it does affect working families and those the retirees up to age 65. So it is heartening to hear that Kaiser is moving into northern Monterey County. And to my understanding, that doesn't include Medicare Advantage for the first year, but they may try in 2026 to extend it to Medicare Advantage. So that really doesn't help our folks who live in Soledad, and because they're not included in even the first wave of Kaiser moving into Monterey County. So they, that puts them out even years more. So I'm hoping that something can be done to expand and protect our healthcare benefits, specifically in southern Monterey and San Benito counties. Thank you.
Thank you for your comments. The committee appreciates your comments, and we share your concerns.
Thank you.
Okay, now is the time to, these are some very robust recommendations we have, so I'll undertake a motion by Mr. Miller to approve the new plan expansions and the new benefit changes, and second by Vice Chair Pacheco. Can we have a roll call vote, please?
Jose Luis Pacheco,
Yes.
Regina Evans, David Miller,
Aye.
Lorena Ortega, Kevin Pelkey, Teresa Taylor, Yvonne Walker, Melissa Willett.
Thank you, everybody. I do want to thank the staff for all the work they've done preparing for the plan year 2025. And I also, like the Vice Chair Pacheco, I'm very happy that we were able to move these low-cost and quality networks into Northern California. There were also other changes in Southern California, so I am very pleased that Health de Salud and MAS was able to move into Imperial County, so that having that low-cost program for another rural county is very helpful. So thank you very much. I'm very proud of this work. Now we move on to information agenda items. 6A. Mr. Don Moulds.
And I'm going to turn it over to Jared Chinneberry.
Garrett.
Good afternoon, President Taylor and members of the board. I'm Jared. Sorry? Oh.
It's all right. That's okay. Go ahead. Please continue.
Yep. I'm Jared Chinneberry, CalPERS team member. So today I'm excited to share our vision for the Health Policy Forum in 2024. It's a new initiative that Don has previewed in prior board meetings. So the Health Policy Forum serves as a vehicle for CalPERS to get input from and engage external experts to better understand critical healthcare delivery, or issues relating to critical healthcare delivery, payment, and services facing CalPERS and healthcare more broadly now in the future. So today we routinely seek insights from external experts on a case-by-case basis. For instance, we recently engaged with over 20 experts for input on our PPO solicitation. The Health Policy Forum is distinct in that it represents a structured, formalized approach for engaging external experts, not on immediate needs, but on emerging healthcare issues and their potential implications for CalPERS and our members. The goal is to ensure that our health policy decisions are both strategic and forward-looking, and we achieve that by being proactive and agile in our ability to anticipate and respond to challenges while staying at the forefront of industry developments. So the Health Policy Forum will be a quarterly meeting conducted virtually. This virtual format enables us to engage experts nationally while being cost effective. The first meeting will occur in Q1 of 2024, with sessions lasting approximately 90 to 120 minutes, varying based on the topic and number of speakers. To foster open discussion and engagement, sessions will not be recorded, but comprehensive summaries will be shared with the board and stakeholders. The Health Policy Alignment and Strategic Support Team will facilitate these forums, which includes coordinating the meetings, securing the keynote speakers, providing relevant background information to attendees beforehand, and summarizing key learnings and next steps after each session. Each forum will feature 1 to 3 subject matter experts who will provide remarks on the selected topic, with the majority of time dedicated to open discussions. To ensure a focused and meaningful dialogue, our team will align the topic with CalPERS' strategic plan, frame the issue by presenting a CalPERS-specific problem statement, provide relevant CalPERS statistics, and ultimately guide the conversations toward actionable insights. Our forum attendees will include health senior leadership, assistant division chiefs, health subject matter experts from within the enterprise, and up to 2 Pension Health Benefits Committee board members chosen by President Taylor. The team will distribute information to attendees a week before each meeting, including details shared with the speaker and a brief article on the chosen topic. As we prepare to launch this initiative, we're seeking input from board members on our initial focus areas. Our team discussed a number of topics that we think would be worthwhile to cover at some point, but there are 3 that we thought were particularly important, and we are proposing to do these first. So the first one being pharmacy, which is, of course, one of our largest cost drivers. We spend over $2 billion per year on pharmacy alone. The industry is notoriously opaque, with many middlemen between the manufacturer and the consumer, which makes it more challenging for purchasers like CalPERS to address the root of the issue to negotiate effectively. In addition, specialty pharmacy drugs are a rapidly growing share of our total drug expenditure. They are typically used to treat chronic, serious, or life-threatening conditions, and they can cost many thousands per month. And there simply aren't enough low-cost generics and biosimilars. So there's really a lot of different topics we could explore in the pharmacy arena, and we would love to do that. The next topic for consideration is artificial intelligence adoption in healthcare. So AI is a rapidly evolving area, and we would like to devote more time to understanding the benefits, risks, and implications for CalPERS and our members. We know that our health carriers and network health systems are actively working to take full advantage of AI, and we need to do what we can to get out in front of it, ensure it works in favor of CalPERS and to the benefit of our members. And our third proposed topic is assuring members get the highest quality and best value care possible. So this, of course, has been an ongoing focus for CalPERS with our application of reference-based pricing and centers of excellence, to name a couple. So we would like to continue to push the envelope and explore how we can advance our existing strategies and implement some new innovative strategies. For instance, navigation support to help guide our members to the best possible clinicians. We have identified a number of additional topics that we think would be worthy of future forums, such as promotion of alternative payment models, fostering prevention via incentivizing healthy choices, additional opportunities for alignment with other purchasers, and health equity. So thank you for your time. If you have comments or suggestions regarding these forum meetings or topics, we would love to hear them.
Thank you. We do have some comments for the committee. We'll start with President Taylor.
Hi, thank you, Jared. Sorry about that. So I was looking at this when I was reading the board books, and so this is us by ourselves, and I was wondering, I know that we communicate often with Covered Cal and Medi-Cal, Have we thought about including them in this, or is it just for us?
I think we contemplated it being just for us, but I absolutely think that they could actually be probably speakers in the forum itself, if not, just participants.
I think that's a terrific idea. The more we do with them, the more we come to the conclusion that we should be doing even more with them, particularly covered in DHCS. There are topics that will be front and center for them and topics that aren't. Covered farms out the entirety of their pharmacy benefit to their insurance companies, so they don't spend a lot of time over there thinking about new strategies on pharmacy, for example, so maybe not there, but certainly in other places. I think that's a great idea, and one of the things that we're going to want to queue up in a future is, as Jared alluded to, is new opportunities for collaboration. Certainly that's good, but they have both the expertise and there's just a lot of synergy there. So thank you for that.
Okay, yeah, something that I think is really important, because I think as a purchasing power, us and covered bare minimum, right?
Very powerful. And when you add DHCS in there, it's particularly formidable. Yeah.
Yeah. So I think that's really important. This is a great idea, and I really appreciate this. Thank you.
Thank you, Ms. Taylor. Trustee Violette.
Thank you so much. I also echo President Taylor's comments that this is a great idea, and to be more inclusive and collaborative, the better. And you asked for topic ideas, and of course, I would love to see a topic of understanding and addressing racial disparities in the healthcare. What continues to contribute to racial disparities, the history of, and potentially healthcare disparities in the context of broader inequality, if that would be a possible topic.
Yeah, absolutely, and totally agree. It's a really important area, and we certainly can consider that and add that to the future agenda.
Thank you.
Thank you. Mr. Pacheco, next, please.
Yes, thank you, Jared, for your report here. I just wanted to ask, have you decided which one will be the first one, or?
Not decided, but we were leaning towards pharmacy is our initial focus. Really, the first three on the left there of the slide is really what we were thinking of our sort of initial focus areas.
And then you also mentioned subject matter experts. Can you elaborate on who that may be, or what experts are you looking into?
Yeah, so we're not limiting ourselves here. So we were thinking, it could be people, could be academics, it could be people in health policy like think tanks, it could be folks from other large purchasers, so we can explore sort of what strategies that they have deployed and their lessons learned and so on. It could be other agencies, like Cover California. We're really not limiting ourselves because it depends on the topic.
So a diversity of academics and subject matter experts around the country and so forth to come together in this forum to provide best practices and so forth.
Yeah,
precisely.
I'll add that we're going to be exploring the possibility of foundation participation, support for discrete targeted research projects, potentially that flow from some of this content, and for the convening. Part of the purpose of the virtual aspect that Jared alluded to is that it's a lot easier to get the best people in the country when you don't make them fly across the country to have a 2-hour conversation. So we're trying to do that as inexpensively as possible, but we do think that there will be research opportunities to really probe on ideas that we want to pursue, and we'll be reaching out to foundations for potential support on some of those projects that have really a broader value, not just to us, but to other purchasers.
Oh, wonderful. And I just want to make a comment that on number 3, I do appreciate the navigation support. I think that's an area of interest, and I think that will, again, be another, hopefully, something that will enhance the care for our members in the long run. Thank you.
Thank you. Mr. Miller, please.
Yeah, thank you. Really appreciate all the information. And it may be beyond the scope of what you're envisioning for this health policy forum, but some of the things I've really observed over many years, but there's some big shifts in kind of the business models and the opportunities out there in this whole field. And some of the things that I think are interesting and have long thought potentially are food for thought for us, both on with our healthcare hats on, but also with our investment hats on, is, for example, the blinking out of community hospitals and the mad scramble of systems to fill that gap, primarily with community-based outpatient clinic models, as well as the buying up of some of these facilities and kind of revamping them and bring them back online. We're seeing more and more private equity money chasing some of those opportunities, regionalization, things are happening different in different parts of the country. I think I just look at the Central Valley here and see the success of Adventist with their approach to community-based outpatient clinics. And so whether they're really, where is that all going, and are there opportunities for us in the future with strategic partners in some of our longer-term investing approaches to be aware of some of those changes? There's similar things going on in the long-term care industry, which is a huge and burgeoning need strategically that the industry is just kind of floundering around finding its way, but I think there'll be tremendous opportunities there as well, and that we need to, I think, keep abreast of, both to be able to continue to provide the kind of quality care and access to care for our members, but also to, be part of that change and recognize where there's opportunities for us to advance that change in the right direction and potentially benefit from it on behalf of our members.
Yeah.
Thank you, Trustee. There are some very interesting discussion points. Kevin, please.
Thank you. I really like the topics already listed here. And without reiterating what my colleagues have already said, in an era of instant access and social media, there's a lot of misinformation out there. And so I would encourage us to find the best of the best in providing this information to our members, because we want to make sure we have the professionals giving us that expertise. So thanks.
Yep, that's a great idea.
Thank you. I don't see any more comments from or questions from my colleagues here. So we'll move on to summary of committee direction.
Thanks, Jared.
I took down just one item, and that was to provide the board with instructions on our website for retirees to call and get their warrant information.
And the VCR, yeah.
Yeah, and there's actually, I pulled it up on my phone very quickly. If you go to the website and you click on retirees, it's the top one that comes up. And it says with one simple call, and it talks about how to do it via phone and also the upcoming link. So we'll make sure to get that website link to you guys.
Thank you, Ms. Mall.
And I'm not sure whether these are committee direction or just good ideas that we think are good ideas, but the first one I have is adding our other public purchaser partners, Cover California and DHCS, to the policy form where appropriate. Second is adding a future policy form to address the issue of racial disparities. And then the third one is a potential future policy form on health misinformation and consolidation. And just I will add that has always been one of our most important topics. We launched a bunch of initiatives that are still underway, which is why we didn't put it on the front burner, but I think putting it back on the front burner periodically is an excellent suggestion, so we'll add that to the list. Thank you.
Yeah, please do take them as a committee direction, Mr. Bond.
Happy to. Thank you.
This public policy forum promises to be very exciting for us. Now we'll go to public comment. We'll start with Mr. Burns. Oh, I'm sorry. I apologize, Trustee Rufino, Frank Rufino for Fiona Ma.
Thank you, Mr. Chair. I'd like to rise for a point of personal privilege, if I may, Mr. Chair.
Please.
Thank you, Mr. Chair. And good morning, Madam CEO, Mr. Molds, Ms. Ma. We don't hesitate to complain when something doesn't go well. You know that very well. And we should not hesitate to commend when something is done right. And so the Treasurer's Office would like to take this opportunity this morning and wants to recognize the outstanding work of Timothy Nichols, Louis Lemus, I apologize if I butcher your name, Louis, and Trevor Turner in assisting one of our constituents through a very, believe me, very complicated healthcare enrollment. Mr. Nichols, in particular, did an outstanding job in navigating our office through this process. So thank you to the whole team, and thank you, Mr. Chair, for the opportunity.
No, good to hear it. Thank you. Okay, now we will proceed with public comment. Tim Burns and then Al Darby.
Good morning again. Chairman Rubalcava, members of the committee. I was happy last week at the Stakeholders Committee when we heard that ACO REACH is going to be actually on the agenda for the January board meeting at long last. Thank you for putting that on there, whoever did. We urge the board to support the California legislature who sent a request to President Biden to stop this pilot program for Medicare, privatizing Medicare. Yesterday, we heard from union members. We kind of heard about the dark side of private equity. We heard from union members how they were treated by private equity firms, including their retirees, and how they were treated in housing that was owned by private equity firms and getting their monthly rates raised by $200 to $300 a month. These same private equity groups are buying into ACO REACH as providers of Medicare. They're being promised 30% profit. And it doesn't take a wise person to figure out that if you're going to give somebody 30% profit, the great service that we are used to getting from the government for Medicare is going to be reduced. And in some cases, some of this dark side things that happen to these union members are going to probably happen to us retirees too. We tried to contact the companies that names we were given, the private equity companies that are in this pilot program. We got 2 responses. 1, they didn't answer the phone. 2, they didn't know anything about the questions we asked about Medicare. So much for vetting private equity companies. Because we sat here and listened to a conversation a year ago with 2 people from Washington, D.C. and a professor from California debating the ACO REACH program. And we were told by both these young ladies not to be worried, that all of these companies buying into this pilot program were going to be well vetted, and you will be well protected as Medicare recipients. I'm not so sure about that. So again, I'm hoping that the board in January will consider supporting the California legislation and the message sent to President Biden to stop the ACO REACH program privatizing Medicare. Thank you.
Thank you. Al Derby.
Mr. Chair, committee members, Al Darby, speaking as an individual CalPERS member. I support the CSR proposal to move administration of the dental plan from CalHR to CalPERS for active and retirees of CalPERS. Due to the Delta dental plan remaining almost static for 40 years, a very serious review of the plan is dictated because of the apparent unrecognized need for updating in benefits and the structure of payment to dentists as well. The other thing you might want to consider is moving the VSP plan over here as well. That way you put everything under one roof. Could be eliminating some duplicative effort. Thank you.
Thank you. Leonora Fretwell, please.
Eleanor Hunter Fredwell with the state retirees. I'm going to take a little thing out of what Frank said. When something's done good, you should say something about that. So I want to talk about the warrants. I go to all the chapter meetings. When I go, I tell them about the warrants, the new thing that we have now, to check your phone. And I tell them it's 113. And I tell them how awesome it is that we can do that, how y'all worked on it, how we have acts and acts and acts, and y'all have did progress, so it's good. So right now we have 3 ways, and pretty soon in January we'll have 4 ways. So I explained to them now that when you go to your phone, it's better than getting it in the mail, because you can stay in your bed. You can call, you can look at it, you can call, you don't have to go out to the mailbox no more, you can check it 3, 4, 5 times. So I want you to know I do, when something is done good with the board, I do go out there, I do support you, I do say what's what, and some people listen and say, right, I said, right. Just sit in your bed, don't have to get up and no clothes on, check what's on there, see what's what as many times as you want to. Otherwise, you had to wait in the mail, you had to wait if the mailman didn't deliver it or anything like that, so I told them that. But I also told them that even the ones that was 80, they was getting it through the mail. Some of them said they got theirs already, so that was a plus. And I told them that in January we'll have something that's pushed to our phone, if I'm not mistaken, and we can look at it. So I told them all the progress that you have done, and we got like 5 different ways, and hopefully that'll meet some of our members, you know, what they can do different ways. And they can still call in for a warrant if they want to be mailed to them, and they can still check online. So I want to say thank you for that. Appreciate you.
And thank you for your public comment. That adjourns today's meeting of the Pension and Health Benefits Committee. I think we need a break for the court reporter, and then we'll resume with the Risk and Audit Committee. All right. Thank you, everybody. Whoever the chair is of the, who's the chair of the risk?
So we're asking.
We're asking you.
Okay.
Oh.
Let's do it 11:30.
11:30. Thank you.
Okay, I'm going to call the Risk and Audit Committee meeting to order. I have 11:31. And the first order of business is the slow roll call.
David Miller.
I am here.
Lisa Middleton.
Present.
Regina Evans. Frank Rufino.
Present.
Jose Luis Pacheco. Ramon Rubacava.
Here.
Melissa Willett.
All right. Well, on to item 2, our executive report. Good morning.
Good morning, Mr. Chairman, Madam Vice Chairman, committee members. I'm Kevin Fine, CalPERS team member and Chief Compliance Officer. Pleased to be with you here this morning. Today, you'll be asked to approve the independent auditor's report for the fiscal year 2022 to 2023, and the independent auditor's management letter. The next Risk and Audit Committee meeting is scheduled for February, and it includes the election of the Risk and Audit Chair and Vice Chair, mid-year updates to the 2023-24 annual plans for the Enterprise Compliance and Enterprise Risk Management divisions, as well as third-party valuation and certification of the 2022 CalPERS annual valuation of the Judges 1 and 2, legislators, and 59 survivor pension plans. That concludes my report. I'm happy to take any questions.
I'm seeing no questions, so that will move us to our action consent items. What's the pleasure of the committee? Okay, moved by Director Pacheco.
Second.
Seconded by Director Middleton. Any discussion? I'll call for the question. All in favor? Aye. Aye. Any abstentions? Any nays? It's unanimous. The ayes have it. I haven't had any requests to pull any of the information consent items in item 4, so we'll move on to item 5, our action agenda items.
checking the time. Good morning, Mr. Chair and members of the committee. Lee Shupui, Office of Audit Services. Agenda item 5A is an action item. Staff is requesting the Risk and Audit Committee to approve the board's independent financial statement auditor BDO's audit reports for the fiscal year ending June 30, 2023. I want to turn it over to the BDO staff here presenting with me today.
Hello, Chair, Vice Chair, and committee members. I'm Billy Kim with BDO. Thank you for the time for us to come here to present our audit results to you. With me here today, I have Sylvia Mack at the end, and then also Deepika Nigan as well, who are both audit directors that work with me, assist me in leading the audit team. Also calling in is Keith Hammond, who's also on the phone, who's our quality control reviewer as well, who assists me in ensuring that we adhere to quality standards. Overall, in terms of our scope of audit, if we can go to slide 4, please. Yeah, in terms of the scope of our audit, it includes the audit over the CalPERS basic financial statements, and this is for the fiscal year ended June 30th, 2023. This includes the financial statements over the fiduciary funds as well as the proprietary funds of CalPERS. Currently, we are substantially completed with our audit, expected to be issuing at the end of this week. And we're expected to be issuing an unmodified audit opinion over the financial statements for CalPERS. I'll also be issuing a report over internal controls over financial reporting and compliance. A draft of both of these have been provided in advance, and they're attached as agenda item 5A. I also want to highlight that overall, from a audit coordination perspective, we receive full cooperation from management throughout the audit. All of our requests that we've asked for were made available upon for inspection. If we can move to the next slide, please. So this slide here discusses about the results of our audit. I'm going to highlight a couple of different items here. So first off, as it relates to significant accounting practices and policies, there are no changes that we had noted in the current year. As it relates to significant accounting standards, there are no specific significant ones that we've noted that were adopted in the year. In terms of accounting estimates, there's 4 areas that I wanted to go through and talk with the committee, 2 of which I would consider to be significant estimate areas. The first is area related to valuation of private equity and real asset investments as of June 30th. This is where you have associated audited statements of those funds, and particularly ones where you have a separate year-end that's not consistent with the CalPERS year-end. So what I mean by that is the CalPERS year-end is June 30th, while a large portion of the private equity and some real asset investments funds have a year-end of December 31st. Therefore, there's an estimation involved in assessing the change in value of those investments for that period of time between the audited financial statement date of 12/31 for those investment funds until June 30th, which is the date of the CalPERS financial statements. So for these investments, management has a process in place in obtaining, analyzing unaudited investment valuation information as of June 30th, and they receive, the relevant information from each of the investment funds as part of their financial reporting process. And we, as part of our audit work, we assess this analysis and the entries that are made or related to this area, and some of the work that we do as relates to this audit work includes auditing their contributions that are made, distributions that are made as well, also auditing the unrealized gains and losses throughout the year, and then also doing this through a combination of analytical procedures, detailed testing, and also confirmations that we sent to the underlying investment funds. So based upon the work that we performed, we noted no specific issues related to the valuations of investments. The next area of estimation is significant estimate is the liability for future policy benefits. This is specifically related to the long-term care fund. This is a liability that's derived from a roll-forward method and includes assumptions from the latest valuation report. And one of these key assumptions that we specifically look at is the discount rate. And based upon the work including by our own independent actuarial specialists, we noted no issues with that discount rate amongst the other assumptions involved as well. Procedures over this included performing also an analytical analyses, sample testing, and also procedures on ensuring that there's accuracy and completeness of the data used within the models as well. So we noted no specific issues with those procedures. However, this year, this estimate was also impacted by the long-term care class action settlement. So this actually involved a proposed audit adjustment proposed by my team, BDO, to properly reflect the future participation in the plan, which we'll detail further on a separate slide. Other estimates that we did also focus on as part of our audit work is the healthcare fund estimated claims liability. Now, this is a liability that uses actuarial methodology based on historical claims data for each of the medical plans. And then lastly is an estimate for pension liabilities for cost-sharing plans, including the PERF B, PERF C, and then single defined benefit plans. For these areas, on top of the detailed testing performed, we also utilized our own actuaries as well, independently, to review management's actuarial models, methodologies, calculations, and also the related assumptions. So based upon the work performed, we also noted no issues for those other two estimates. Slide 6, please. This slide talks about the qualitative aspects of the CalPERS financial reporting process, and all of which is what we assess as part of our audit work. Now I'll pass it off to Deepika, who will present the remaining slides.
Thank you, Billy. Can we move to the next slide? Okay, so this slide here shows the misstatement Billy was talking about earlier. I just wanted to mention that management has recorded and corrected for this. The first part of the entry is actually to overstate the LTC future policy benefits liability in the amount of $632 million. The initial entry to the liability did not reflect the impact of members who expected to surrender their long-term care policy as part of the settlement. The second part of this entry is correcting for, is to reclassify the $764 million in settlement-related expenses into the correct expense line item, moving the initially recorded amount from claims expense into settlement expense. All right, and next slide. One more. Okay. This slide points out that we are required to report any material weaknesses or significant deficiencies identified as part of our audit to the Risk and Audit Committee. It also contains the definition of each deficiency level. We noted one material weakness related to the adjustment that we just mentioned. The material weakness was issued over the internal controls pertaining to the assessment of the appropriate accounting and presentation of the estimated settlement liability within the LTC fund. We will cover this in more detail in our next agenda item. Next slide. One more. Thank you. Okay, and this slide here, the next couple slides actually
are covering our other required communications. I will highlight a few of these for our meeting. The first one is that there weren't any major changes to our planned audit strategy or our risk assessment that we communicated to you in June. The second, we utilize our internal firm specialist for, which included investment valuation and our actuarial specialists as well. Third, with regards to the June cybersecurity incident that occurred at PBI, the third-party vendor, we reviewed management's investigation of the breach by performing inquiries with management and counsel, reviewing the contract with the third party, and reviewing other supporting documents. Based on our review, we do not take exception to the conclusions of management's investigation. Next slide. So the last piece I wanted to cover here is that there were no disagreements with management or any significant difficulties encountered during the audit. And then the next slide. Okay, this slide here is related to independence. As required by our professional standards, we have reaffirmed to you, the committee, that as your external auditors, we are independent of CalPERS. Next slide. Okay, this final slide contains information regarding BDO's quality management to remind you that we are subject to quality management standards and we strive to ensure we adhere to these standards. Thank you all for your time, and that concludes our planned presentation.
Okay, thank you for that very clear presentation, and particularly thank you for the explanation of the timing on how the impacted those. That makes it a lot more clear right from the get-go, so easier for us to understand. Okay, I have Director Middleton.
Great, thank you. And thank you for the report. Thank you for this. I want to go back and just fill in some information with regarding the one change that was there. This was recorded originally as a claims expense in the amount of $631,700,000. Is that correct?
It was claims expense of 764 million.
The other way.
Yeah, the other way.
Other way. All right.
Yeah, so the second part of the entry was just to reclassify from one expense area to the other, so from claims expense to the settlement expense change.
So in both instances, this was an expense and it did not change the bottom line profit and loss of CalPERS. Is that correct?
That specific part of the entry did not, but there was also the first part of the entry that essentially cause a reduction, right, in terms of the amount of the overall liability for the long-term care benefits. Yeah.
And the original date of when this was recorded as a claims expense was when?
Can you repeat the question again? Sorry.
When did it first appear as a claims expense? And what I'm trying to get to is the timeline. When did CalPERS record it as a claims expense? When did you identify that it should have been a settlement expense of a different amount, and when was the correction completed?
Yeah, so in terms of them recording as a claims expense, I believe this was part of their closing process, right? That took place, say, in July, around July-ish timeframe. And then when we had identified this as we were going through and auditing the related support and reviewing the financial statements, which was, I believe, at the end of September, beginning of October.
Okay. Yeah. And was there any debate within
within
CalPERS as to whether or not to make this change?
No, there was discussion, but initially it was just making sure we were on the same page as it relates to the facts of the matter, right? In terms of, and there was no disagreement.
All right, thank you very much.
Yep.
Okay, thank you. I have Director Pacheco. Oops, there. Oh, hit your button again, Jose Luis. There we go.
Thank you, Chairman Miller, and thank you very much for the report. It's always very enlightening when I read this. My question is back to the significant accounting estimates and the private equity and real estate investments. Now, when you were in the process of doing that, did you look at all of them, or did you take a sample of the investments?
Yeah, we do a sampling approach, and so we do end up going through, and based upon our guidance and sampling methodology, we do make selections across. And
from your analysis, you mentioned that most or many of the from the sample, they were in this other year. They were the private equity evaluations were evaluated to December 31st, while our fiscal year is from July to June 30th. Is that correct?
Yeah, just to clarify,
yes,
the investment funds are audited. Usually, a lot of these private equity funds are calendar year end, so when they get an audit, it's done as of that calendar year end.
Mm-hmm.
So given that's the case, there's 6 months, right, that is that's different in terms of what's unaudited, so to speak, of investment activity for that investment fund. But there's still underlying statements and support that's received from the investment fund, so that you're able to properly assess what the change in value should be. But that is something that what we end up doing is receiving all that information that management has received and assessed,
mm-hmm.
and then also just ensuring that we're coming to the same conclusion.
So from the estimates, then you're estimating
yes.
from what's been provided from these from the private equity funds and so forth, and reconciling it with respect to what our stuff is on our side on CalPERS.
Yes.
Okay, very good then. That's all I wanted to know. Thank you.
Okay, Frank Ruffino.
Thank you, Mr. Chair. Just a couple of questions. Will the recently proposed changes in ESG reporting requirements, will they affect CalPERS financial statements going forward?
I mean, it's definitely something that should be considered, right? But, you know, as relates to what is going to be, I guess, effective, right? It's still being assessed, right? So that is something that we tell all of our clients we should be keeping abreast of what's going on in that, and you know, the ongoing regulation requirements that will take place. But for the near future, we're seeing a lot of organizations just voluntarily just trying to move in that direction of voluntary adherence to a lot of the things that are coming out from these from the ESG standards.
So sounds like nothing. Difficult to say whether or not they will affect us in some ways.
Eventually, right? But I think at this point, you know, it's not necessarily something that would be effective like this coming year, etc. So,
okay.
Yeah.
And along those lines, is there any significant new GASB rules in financial reporting that will affect next year's financial statement?
No, there's nothing that we're aware of that would have a significant impact for this coming year.
And lastly, was there any asset class that received special attention during the audit?
Yeah, as relates to what I had just specifically mentioned about private equity, real assets, and that's again based upon the risk assessment that we do. But all of the asset classes, so have been subject to audit. We've done audit work over everything related to investments, whether it's public equity, debt, but we do take some special consideration and extended procedures over private equity, real assets, especially where you have this gap period that I had talked about.
And maybe I should have said, you mentioned the private equity. Other than private equity, any other asset class that that requires special attention, for lack of a better word?
No, but they are all subject to audit. We do audit procedures to cover our basis to make sure we're covering the risks of material misstatements for those areas. Yeah.
Okay. Okay. Thank you. Thank you for your work. Thank you to the whole team, actually, that's involved. I know it's not a small task. Thank you, Mr. Chair.
Okay. Yep. And again, thank you. It's always amazing to me how much work gets done. I know this year there were some challenges with some changes internally with who was working on what and everything. And so I'm glad to hear that things went well, that our working relationships continue to be strong, and that everybody was able to get what they needed, and we've got good work product in front of us. And thank you to you and your whole team, and thanks to CalPERS and the whole CalPERS team, because it's definitely a big lift for everybody, and requires a lot of teamwork and coordination among everyone. So thank you all. And with that, we'll move to 5B, the review of the independent auditor's management letter.
Mr. Chair, that was an action item.
Oh, no, that's right. We have to vote on them separately. Okay. So I'll entertain a motion to approve. Okay, moved by Director Pacheco, seconded by Director Middleton. Any further discussion? Hearing none, I'll call for the question. All in favor? Aye. Any nays? No abstentions? The ayes have it. It's unanimous, and I didn't have any requests for the public to speak, so that will move us to 5B.
Mr. Chair and members of the committee, Belize Shapui again. Agenda item 5B is also an action item. Staff is requesting the Risk and Audit Committee to approve the board's independent financial statement auditor, BDO's draft management letter. I want to turn it back over to the BDO staff.
Thank you, Belize. Mr. Chair, Madam Vice Chair, and members of the committee. In planning and performing our audit of the financial statements of CalPERS for the fiscal year 2023, we considered CalPERS' internal controls over financial reporting as a basis for designing our audit procedures for the purpose of expressing our opinion on the financial statements, but not for the purpose of expressing an opinion on the effectiveness of internal controls. Topeka provided to you with an overview of the definitions of control finding categories in the prior agenda item, so I will not go through those with you again. In connection with our audit, we identified one material weakness and one deficiency. I'll start by reviewing the material weakness. Each year, CalPERS estimates the amount of liabilities associated with the long-term care fund future liabilities. Recently, the settlement of the class action lawsuit impacted the probability, timing, and nature of those future liabilities. Generally accepted accounting principles require changes in estimates of claim costs be recognized in the period those estimates are changed. Management had correctly estimated the long-term care settlement liability. However, the offsetting impact to other accounts because of those changes were not, which resulted in a material overstatement of the long-term future benefits liability and related expenses and a misclassification of the settlement expense. The adjustment to correct the error was proposed by BDO and corrected in the financial statements by management. We determined the error resulted from a material weakness in review controls surrounding the appropriate accounting and presentation of estimates related to the estimated settlement liability for the long-term care fund. The initial entry was recorded without considering all current information, including details on how the settlement would impact future participation in the plan. We recommend management implement a control for significant and unusual transactions where management ensures they obtain and consider all related information when assessing accounting conclusions. Management has indicated to enhance internal controls going forward, Financial Reporting and Accounting Services, FRAS, will review any entries related to unusual transactions to make sure all related information is considered before recording in the financial statements. If transactions are identified, FRAS will assess for proper accounting and recording in accordance with U.S. generally accepted accounting principles. We will monitor the implementation of the control in the coming year and will also further assess the operation of the control put into place as part of our 2024 audit. Next, in relation to the identified control deficiency, we observed 7 developers in the automated real estate investment system, ARES, with security administrative access to the database of ARES. The database administrative access role provides users with the ability to deploy changes directly to the system without oversight. We observed users with database security administrative access have full access to the database, meaning they can read, write, and edit. This results in a segregation of duties conflict because it provides the individual with potential ability to modify the report logic within the database without approval. Although CalPERS segregated developers and deployers on the application level, having full access to the database can bypass the system functionality, resulting in a segregation of duties conflict. Additionally, no audit is being performed of the system change log or the database login access report to check for and investigate anomalies. In response to the deficiency, management has removed the developer group's access to the production database. We recommend to further strengthen controls, changelogs be reviewed on a regular basis for appropriateness by an individual who does not have deploy access or database access to ARES. We will continue to monitor the improvements to the control into the coming year and will also further assess the operation of the control put into place as part of our 2024 audit. Finally, we also wanted to take an opportunity to look back at the prior year 2022 control finding. As part of the prior year audit, we identified a deficiency related to the review for classification of investment receivables. Specifically, to appropriately record proceeds receivables from the sale of investments, we had recommended management implement a control during its year-end review to identify whether any proceeds from sales that have taken place prior to year-end are still to be received, and if so, to assess for proper classification of them on the financial statements. During the current fiscal year, management enhanced its controls as recommended to ensure the proper classification of any proceeds from investment sales that have taken place prior to year-end and are still to be received. We concur with management that this control finding has been remediated. This concludes our remarks on the management letter, and we will open it now for questions. Thank you.
Thank you. We have a question from Director Pacheco.
Again, thank you very much for this letter and so forth. So my first question is around the developers. So the 7, you mentioned there were 7 developers that had full access. Am I correct for into the database production?
Yes, that's full access. So they had full administrative access to be able to read, write, and edit.
And before that happened, was there any, when you were reviewing the documentation around this, was there any sort of governance or security governance documentation that could have given some guidance on why that was the case beforehand? Or I'm just curious.
No, so as part of the policy, they're not supposed to have that type of access, right? And so that is something that we had observed as an issue, right? And but at the same time, I would just say we did not see any evidence of any thing that they did inappropriately.
Okay. Yeah. And then now, moving forward, now there's segregation of duties then, so there's now a new enhanced internal control now.
Correct. It was the access was removed pretty much right away once CalPERS was informed.
And so moving forward then, when we do these audits again, we will be able to make sure that's as a follow-up next year.
That's correct. Yeah, we will continue to monitor that to make sure that the access has continued to stay removed.
Thank you very much.
Okay, I'm seeing no other requests to speak, so thank you. I appreciate that. Again, appreciate the work and appreciate the clarity of the letter and the ability for us to follow up again. And we'll see, hopefully, as with virtually all these things, once they've been identified and mitigated, we get the reporting that it's been an improvement and it's worked. So let's hope that we continue that into the future. So, okay, at this point, I don't have any requests from the public to speak on this item, so we'll go ahead and I'll entertain a motion to approve by Pacheco, seconded by Middleton. So I'll call for the question. All in favor, please say aye. Aye. Any nays? Any abstentions? It's unanimous. The ayes have it. And that moves us to our information agenda items. Summary of committee direction.
Thank you, Mr. Chairman. I took note of no committee direction.
Okay. So, and I have no requests to speak from the public at this point, so we'll recess now into closed session for items 1 to 3 from the closed session agenda. Then we'll immediately reconvene in open session after the closed session. Thank you. I don't need the gavel. Yeah. bring us back to open session. So we're back in open session, and unless I hear an objection, we are adjourned. We are adjourned, and we'll be back at...
Finance and Administration Committee will begin at 1:45.
1:45 for Finance and Administration.
call to order the November 14 Finance and Administration Committee. First order of business is roll call.
Lisa Middleton.
Present.
David Miller.
Here.
Frank Rufino.
Present.
Jose Luis Pacheco.
Present.
Ramon Rubalcaba. Teresa Taylor.
Here.
Yvonne Walker.
Here.
All right. Thank you. Next order of business is the executive report. Michelle Nix.
Good afternoon, Madam Chair and committee members. Michelle Nix, CalPERS team member. It was nice seeing many of you at the CalPERS Educational Forum last month. I'm happy to report that during the event, our pensions, contracts, and pre-funding programs met with over 40 employers for contract consultations. The agenda before you today has 2 action items for your consideration. We are seeking approval for the 2023-24 mid-year budget revisions and the 22-23 basic financial statements. In addition, we will have 2 information items. The Actuarial Office will present the annual review of funding levels and risk report and the semi-annual health plan financial report. The next Finance and Administration Committee meeting is scheduled for February 2024 here in Sacramento. The agenda will include valuation reports for the legislators' retirement system and judges' retirement system 1 and 2. Thank you, Madam Chair. This concludes my report, and I'll be pleased to take questions at this time.
Thank you. Are there any questions for Ms. Nix? I've not received any requests to remove any of the action consent items. Could I get a motion to approve? Second? Second. All in favor, please say aye. Aye. Any opposed? Any abstentions? Items 3A through E are approved. We have information consent items. Is there a request from anyone on the board to remove any of the information consent items? Seeing none, information consent items are received and filed. We will move on to agenda item 5A, the mid-year budget revisions. And with that, Ms. Nix and Mr. Schaafsma.
Yes, I'd like to introduce Will Schaafsma. He's our budget chief that we hired in the last, six months? Yeah.
Good afternoon, Madam Chair, members of the committee. Will Schaafsma, CalPERS team member. Today, I will be walking you through the 2023 proposed mid-year budget agenda item. This is an action item which will need your approval. Next slide, please. The total proposed increase to this year's budget is $15.7 million, or 0.6%. This increase is primarily driven by employee compensation updates, bringing on additional investment office positions, and increased external management fees. These increases are partially offset by a decrease to third-party administrator fees. Next slide, please. A substantial portion of the overall mid-year budget increase is due to changes in operating costs. This budget line includes administrative operating costs, investment operating costs, and headquarters building account costs. The total increase for the operating cost budget is $31.4 million, or 4.1%. Next slide, please. The main driver for the increase in the operating cost budget is administrative operating costs. Changes to salaries and benefits will increase this budget by $30.1 million, or 6.6%. Personnel services changes are a result of collectively bargained salary increases, board-approved salary and incentive compensation adjustments for investment office and executive positions, and investment office reorganization. Operating expenses and equipment will increase by $1.1 million, or 0.8%. This increase is attributable to additional executive search services for investment office positions, third-party administrator and pharmacy benefit manager solicitation services, additional information security software, and consultant support for new compliance and risk programs. This increase is fully offset by salary savings from vacant positions and a funding schedule change for human capital management system migration. Next slide, please. The highlighted line on this slide includes investment and external management fees and third-party administrator fees. As you can see, the total fee budget has an overall decrease of $15.7 million or 0.9%. Next slide, please. We estimate a $28.9 million or 2.2% increase in external management fees due to changes in base fees for global and private equity. These fee increases are a result of additional externally managed assets and commitments related to new partnership agreements. Partially offsetting these estimated increases are reductions in the base fees for all other asset classes due to renegotiated fees and fewer than anticipated new partnerships. Performance fees for real assets reflects a minor increase due to better than expected performance in infrastructure. For third-party administrator fees, we estimate a decrease of $44.6 million or 13.5%. This adjustment is driven in large part by a change to the Blue Shield contractual agreement, which no longer requires a third-party administrator fee. Our pharmacy benefit manager projection has been reduced by $1.3 million, reflecting an updated estimate of total claims. This concludes my presentation on the proposed mid-year budget. I'll open it here for any questions.
All right. Are there any questions for Steph? Seeing no questions, is there a motion to approve? Motion to approve, second by Ms. Taylor. All those in favor, please say aye.
Aye.
Any opposed? Any abstentions? Item 5A is approved. We will move on to item 5B, which is financial statements. Ms. Nix.
If you'll please bring up the presentation for the basic financial statements. Okay, Michelle Nix, CalPERS team member. I would like to present a few highlights from the basic financial statements for the fiscal year June 30th, 2023. The statements will be incorporated in the annual comprehensive financial report upon your approval. Slide 2, please. We ended the fiscal year with PERF total net assets at $464.6 billion. Annual money-weighted rate of return was 6.1%, resulting from strong performance results across all globally diversified asset classes. Drivers of the PERF investment return include gains in public equity and debt holdings, which were partially offset by losses in private market holdings. Next slide, please. The investment return is comparable between time-weighted and money-weighted. The time-weighted rate of return was 5.8%, and you'll recall that we announced this as a preliminary percentage in July, and the money-weighted rate of return was 6.1% as of June 30th, 2023. The 5.8% represents investment performance shown in accordance with investment industry standards. The measure represents investment returns that are available in June, which means the real assets and private equity includes returns from April 1st from last year through March 31st of this year, or commonly referred to as quarter lag reporting. The 6.1% represents investment returns shown in accordance with GASB financial reporting standards. This measure represents investment returns that are available through September, which means that the market movement for the real assets and private assets does not include lagged, means the market for real assets and private assets does not include lagged reporting and considers the last quarter of the fiscal year before the financial statements are finalized. Slide 4, please. This slide compares the differences between the time-weighted rate of return and the money-weighted rate of return. I like to include this because just as a reminder of the differences. So the time-weighted rate of return is basically weighted towards time, and it measures the compounded growth rate over the period being measured, while it eliminates distorting effects of inflows and outflows of cash. The time-weighted rate of return reporting is the standard for investment performance reporting. The money-weighted rate of return is the ACFR, or the accounting rate of return, and it expresses investment performance net of investment expenses and administrative expenses adjusted for changing amounts that are invested. As more cash comes in, as the cash comes in, they try to capture how long we've held the cash, so it doesn't assume that you have the cash for the entire time. Money-weighted rate of return reporting is a GASB requirement. Slide 5, please. The PERF net position increased $25.2 billion, or 5.7%, from $439.4 billion as of June 30th, 2022, to $464.6 billion as of June 30th, 2023. Over the 10-year period, June 30th, 2014 through June 30th, 2023, our net position increased $162.9 billion, or 54%. Next slide, please. Additions to the PERF net position include contributions from employers and members. Investment income is comprised of investment income, dividend income, and net appreciation or depreciation of fair value of assets, fair value of investments, and which are assets. Gross investment gains, including net securities income, were $28.5 billion in fiscal year 22-23, compared to a loss of $34.8 billion in fiscal year 21-22. This was due to investment gains primarily in public market asset classes in the current fiscal year. Employer contributions increased $1.5 billion, or 6.7%, due to increases in employer contribution rates. Member contributions increased $512.8 million, or 9.9%. Deductions from the PERF are comprised of benefit payments, refunds of contributions to members and beneficiaries, and costs of administering the PERF. Benefit payments are the primary expense of our retirement system. For fiscal year 22-23, retirement, death, and survivor benefit payments increased $2.0 billion, or 6.8%, primarily due to the cost of the living increases in benefit payments and to an increase in the number of retirees and beneficiaries of 1.8%. These increased from 775,000 to 789,000 as of June 30th, 2023. Next slide, please. As I just mentioned in slide 6, investment income is made up of net appreciation or depreciation of investments, interest income, and dividend income. As this chart shows, gains were in the public market holdings and losses were in the real asset holdings. Next slide, please. This chart shows the unfunded liability and funded ratio through June 30th, 2022, since the valuations are always lagged in reporting. The unfunded actuarial liability, which is the excess of total actuarial accrued liability over the market value of assets, was $179.9 billion at June 30th, 22. The increase in unfunded actuarial liability over the 10-year period is primarily due to changes in the actuarial assumptions, such as discount rate and mortality assumptions. Additionally, the unfunded actuarial liability amortization payments were less than the interest on the UAL in many cases. Next slide. In fiscal year 22-23, $29.9 billion was received in contributions, while $31.1 billion was paid in benefits. Contributions increased 7.3% from 2021 to 2022, primarily due to increases in employer contribution rates. Next slide, please. That ends the presentation, although I would like to acknowledge that these financial statements, as well as the annual comprehensive financial report, are a collaborative effort across the finance office and many others within CalPERS. So that ends my presentation, and I'd be happy to take questions if you have them.
Are there questions? Yes. We will start with Trustee Pacheco.
Thank you very much. Thank you. Thank you very much. Thank you, Michelle, for your comments here. As always, I always definitely appreciate always the backward look of where we are. You mentioned regarding the pension payment payouts, our principal expense. You said it was 31.4 billion, and it increased from 29.1, I think, from last year.
That sounds right. Yeah. 29.9 billion was received in contributions, while 31.1 billion was paid in benefits.
So 31.4, right? 0.1, sorry, 0.1. So of that, you mentioned it was, what was it primarily due again? I did not recall that.
It was due to basically higher contributions from employers. And that's why the contributions increase. And the employer contribution rates, we had a higher number of retirees.
You had a higher number of retirees, and that's, okay, that's all I needed to verify. Thank you very much.
Okay, thank you.
Great. We have Mr. Rubalcaba.
Thank you, Chair. I just want to follow up a little bit on Trustee Pacheco's question. So the fact that benefit payments are greater than contributions, many times it means it's also a mature plan, meaning there's more retirees that active. Is that I'm assuming that's the case in CalPERS, correct?
Yeah. Yes.
Well, I don't know. Thank you. And so that's why we're so focused on the rate of, on our investment return. So. And the more I hear myself, I realize I didn't have to ask the question. Self-evident. Sorry, thank you.
No, you're fine. Thank you.
Great. Mr. Ruffino.
Thank you, Madam Chair. Two general questions. First of all, thank you, Ms. Nix, for your presentation. The first question has got to do with GASB requirements. So are there any significant new GASB rules in the financial reporting that will affect next year's financial statements?
Well, we have the leases that went into effect, but there was no material effect for us. So that really, as Billy said earlier in the RAC, it didn't affect our financial statements. Trying to think if there's anything significant. There's probably not anything significant. We are working on the subscription-based IT arrangements, but I don't think our assets are so high that it's hard to reach materiality with any of those statements, really. So I would say no.
Okay. And the second one deals with the proposed ESG rules.
Mm-hmm.
So, they're proposed at this point, but will that reporting requirements will affect CalPERS financial statements going forward?
It's really unknown at this time. I believe that the GASB is aware of the ESG that's played out, of course, across the media. And it's on their technical agenda to look at it and to consider it. But no pronouncements have come out or any kind of rules that I'm aware of that we can respond to at this point. So I think they're looking at it, but I don't have any idea what's going to come out of that. The process for GASB is quite a long, deliberative process, and so they'll put exposure drafts out and allow everyone to respond to those. And so as we go along, we may know more when they put out that first draft to be able to, I'll be able to tell you then, but for now, I haven't seen anything.
Okay, and finally, any issues with recruiting? What's your staffing level at this point?
We're probably at about a 21% vacancy rate. I don't think that's that unusual. We have a lot of entry-level positions, in our area. So for that, it turns over because they promote, honestly. I will say that the level of accountants that are available are less than there were 10 years ago. So it does provide challenges in that respect.
Okay, great. Thank you so much. Thank you, Madam Chair.
Thank you. President Taylor.
Hi, Michelle. Thanks very much for both reports. I was going to piggyback on what Mr. Rubalcava and Pacheco were talking about. So the upswings in page 9 of 10, 2018 and 2020, where we actually did have more contributions than we had benefit payments. Can you highlight what that was in regards to how we pulled that one off?
Okay, that may be an actuarial question, and they're going to. Yeah. Okay. So can we defer that question until the actuarial presentation?
Sure. Not a problem. Thank you very much.
Are there any other questions? Ms. Nix, thank you. Very strong report, and we really appreciate all of the effort that goes into what you have given us today. So thank you.
Thank you.
With that, we will move on from the two, or let's see, we need a motion to approve and a second. All those in favor, please say aye.
Aye.
Any opposed? Any abstentions? 5A or 5B is approved. With this, we will move on to information agenda items. And for that, Mr. Sorrento and Randall, please.
Good afternoon, Madam Chair, members of the committee, Scott Tarango with the Actuarial Office. This is our annual review of the funding levels and risk report. It's an opportunity for the Actuarial Office to provide information for the system overall. We look at various funding levels, expected contributions over the next several years, and provide some of the risk faced by the system. We also look at some other information for the system overall. We look at PEPRA, what's happening with PEPRA membership and PEPRA contributions, and as just discussed recently, some questions came up on benefits versus income on the cash flow side. So I think we'll just jump into the review right now, and I'll pass it to Randy to go over those details.
Would help if I turn the right mic on. Good afternoon, everyone. Madam Chair, committee members, my name is Randy Zubek. I'm in the CalPERS Actuarial Office. Very excited today to present this material to you. I hope you find it as interesting and engaging as the Actuarial Office does. Maybe not, but I guess there's hope. I feel like the last two presentations were very efficient and moved along nicely, which I'm going to take as I have a little bit more time to go through these slides. I hope you'll bear with me. I think there's a lot of interesting information here. Before I jump into the slides, I want to have some opening comments real quick. As you probably know, the Actuarial Office produces over 4,000 individual actuarial valuations every year. Each of these is for a specific plan within the CalPERS system. Each plan has its own funded status, has its own contribution requirements, and so in a lot of respects, these plans are fairly independent and could just as easily be operated outside of CalPERS. However, there are some areas where there is commonality between the plans, and that would be most notably, they're all subject to the same investment policy that you select. They're all subject to the same investment performance. If the fund earns 8% in a particular year, every plan earns 8%. They're also all subject to the same funding methods and policies and actuarial assumptions also that the board selects. Now, for the funding levels and risk report, we take all 4,000 of those valuations and combine them together and provide results to you in total or average results, which are very interesting. They tell a story about the operation of the system that I think is interesting and helpful. And because of this commonality that I talked about, the results that are reflective of the whole system also pertain to each individual plan generally as well. So with that, I'm going to move into the slides. Let's see if the clicker works. Okay. The key items we're going to talk about today are the current status of the system, both in terms of funded status, employer contributions. Then we're going to get into a 10-year look back and 10-year look forward of system results. And we're also going to talk about some impacts of PEPRA. This is a new item we've added to our report this year. We tend to get a lot of questions about the impact of PEPRA, and so we thought we would make it just part of our annual report. Then we're going to talk about risks that the system faces, and finally, some of the factors that are used to mitigate or control some of these risks. Okay, let's jump in and talk about the funded status. Funded status tends to be the factor that most folks identify with. If you know nothing else about the CalPERS system, you might know what the funded status is. Generally, the funded status is considered by a lot of practitioners as the most important measure of the health of a system, although the actuaries like to stress that it is only one measure. There are lots of other factors that go into determining how the system's working and how healthy it is. If you look at the bars to the far right, you'll see the funded status for the system as a whole over the last 3 years. You'll see we had a fairly substantial decrease in the funded status from July 30, 2021 to June 30, 2021 to June 30, 2022. And that was due to the minus 7.5% investment return that we received for that year. And then from that year to a year out, June 30, 2023, we see a slight improvement in the funded status from just under 71% to 72%. So one thing that tells us is that even though our return for that year was less than the assumed return of 6.8, it was 6.1, as Michelle indicated in her presentation. We don't need to hit the 6.8 to see improvement in the funded status, although it helps. Clearly, we'd rather get the 6.8, but we can still see improvement in the funded status without reaching our 6.8 assumption. If you look at the bars towards the left, you'll just see the same results over that same 3-year period for different areas of the system. You can see state results versus public agency results, miscellaneous versus safety results. Next slide. I'm not sure my clicker's working, so I'm just going to say next slide, I think, going forward. Okay, so let's take a look at contribution rates, and these are employer contribution rates. The rates to the far left of the chart show the current percent of pay contributions that our employers are making for the year that we're in. So the year starting July 1st, 2023 through June 30, 2024. Safety groups are towards the top of the chart. They have higher rates in general. They're in the purple colors. The non-safety plans are towards the bottom. They tend to have lower contribution rates, and that's basically due to the cost of the benefits that are provided for safety members versus non-safety members. What you see as you go across the page is slight but steady increases in contribution rates are projected, primarily due to the last couple of years of investment losses that the system received. These are relatively high contribution rates. As you probably know, the contribution that we require is made up of two pieces. The normal cost contribution piece, which is basically the annual amount that's required to pre-fund benefits for each of these plans. And then there's a second piece that goes towards funding any unfunded liability that these plans have. So the lower the funded status of a plan, generally the higher that required payment will be to close that gap and get that plan back to 100%. In many cases, our plans contributions, more than half of it is due to those UAL payments. So if we could get the plans up to 100% funded, which is the goal, these contribution rates will come way down. Next slide. Okay, so let's take a look at the last 10 years and also a projection of the next 10 years. And what we're showing here is a projection of the assets, not a projection, a history and a projection of the assets and the accrued liabilities. The solid color bars are the previous 10 years. The striped bars are the projected years going forward. And a couple things that probably jump out. The gray bars, which are the asset values, tend to go up and down, and they're very much driven by the annual investment return in those particular years. And those results tend to drive the funded status of the system, which is the solid black line going across the chart. You can see there's a lot of ups and downs in that funded status result over the last 10 years. The accrued liability bars tend to have more of a consistent upward pattern to them. They're not as volatile as the asset values. They are expected to increase, although over this last 10 years, they increased significantly more than we would have predicted them to increase at the beginning of this 10-year period. And that was primarily due to changes in actuarial assumptions that were required during that 10-year period, most notably decreases in the discount rate as well as changes in our mortality assumptions. Now, as you look in the next 10-year period, now, this is based on us receiving a 6.8% annual return, which is not likely. We're going to show you results under different scenarios, but should we get our 6.8% assumed return and all other experience matches our assumptions, the one thing you'll notice, I think, is right away is that the projected improvement in the funded status is much greater than the change in the funded status over the previous 10 years. You can see in the previous 10 years, we had about a 2% improvement in the overall funded status, even though employers continued to make contributions. I already mentioned the changes in assumptions. That was one of the factors. A second factor in that lack of improvement in funded status was overall we had investment losses in that 10-year period. Even though the average return was 7.1%, the timing of the gains and losses during that period had a pretty significant impact on whether we saw overall gains or losses. We had a big loss just a couple years ago where our asset value was relatively high at that point, so that created a fairly sizable investment loss. And lastly, at the beginning of this 10-year period, our amortization policies didn't require quite as high of a payment towards unfunded liability as it does now. A few years ago, the board adopted changes to the amortization policy that generally require faster pay down of any unfunded liabilities. So the contributions in those early years would be much higher now, not much higher, but would be materially higher under the new amortization policies. Next slide. So this looks a little bit like some of the information that Michelle was talking about in her presentation. It's just a simple 10-year history, 10-year projection of contributions coming into the system versus benefit payments going out. Benefit payments are in the gray bars. We're showing them as negative because it's money coming out of the system. The pattern with those is pretty obvious. They tend to just be continuously increasing at a pretty consistent pace. They're not impacted by changes in actuarial assumptions. They're not impacted by investment gains or losses. They are expected to increase this way and will continue to increase this way into the future beyond this 10-year period. Now, with regard to contributions, first of all, the contributions are broken down between contributions that are required by CalPERS as a minimum contribution by our employers. That's the lighter blue portions of the bars. And then at the top of some of the bars, you see a darker blue box, and those are what we call additional discretionary payments. Those are contributions that employers chose to make above and beyond the required minimums. Some of these are from public agencies. A lot of these are also from the state of California. And you can see contributions have increased pretty consistently during this 10-year period for the same reasons that the funded status didn't improve as much as we would have liked, the three things that we mentioned previously. But again, if we if we assume that those three issues will not be present to the same degree in the next 10 years, contributions should level off. They will increase a little bit over the next few years because of those recent investment losses, but then they should start coming down. And even beyond this 10-year period would come down significantly faster than what we're showing here, provided that, again, all experience matches our actuarial assumptions. Now, the black line through the middle is just the difference between benefit payments and contributions expressed as a percentage of the assets. We sometimes call that negative cash flow if it's a negative number. It has been negative for a number of years. It was positive in a couple of years, to Ms. Taylor's question. And you can see in those 2 years there were fairly significant additional discretionary payments, the dark blue portions of those bars. So really it was those payments that created the positive cash flow in those couple years. We expect negative cash flow in a pre-funded system like this. This is not a cause for concern. It's projected to grow more and more negative. Again, not a concern. It's a good thing for us to project and monitor and provide to our investment consultants, primarily for them to ensure that there's the appropriate amount of liquidity within our investments to be able to continue to pay benefit payouts. But the fact that the benefit payments are larger than contributions is not a source of concern. Next slide. Okay, let's talk about PEPRA really quickly here. A couple slides here. The first slide is just showing us how our PEPRA population started and increased over the last 10 years and is projected to continue to increase over the next 10 years. So the blue bars are our PEPRA folks, and the gray bars are our classic folks or non-PEPRA active members. You can see when PEPRA was enacted in 2013, we started out with none, essentially, and that number started to grow, and will continue to do so over the next 10 years. We're at about 60% now of our active members who are subject to PEPRA. We're projecting it looks like about 85% by the end of the next 10 years. Next slide. So the important aspect of PEPRA is, of course, the ability that it has to sort of bend the cost curve down a little bit to provide more affordable required contributions for our employers. Now, because the rules applied only to people hired after the enactment of PEPRA, we had to wait for PEPRA members to join the system before we started seeing contribution decreases for our employers. So each of these bars represents the estimated savings solely due to the enactment of PEPRA. And in the last 10 years, we were able to save over $4 billion, which is pretty good. But over the next 10, we're expecting to save 5 times that, or almost $25 billion over the next 10 years. And in that final year, those savings will just continue beyond this 10-year period. Next slide. Okay, I want to talk about some of the risks that the system faces, and most of these are investment related. There are other risks. They're talked about in the report to some extent. The big risk is not hitting our assumed 6.8% return. This particular slide is showing you, based on some stochastic modeling, the likelihood that our plans might drop below 50% funded over the next 30 years. I think probably what we should focus on today is just the median results, and what we can see, we've got them broken down between safety plans and non-safety plans. So the median result here for miscellaneous plans was about a 23% chance that any one of these plans will fall below 50% funded over the next 30 years, and a little bit higher for the safety plans. Now, the difficulty with a chart like this is that there's no particularly good result or desired result. It is what it is, and it's always a trade-off between risk and reward, typically, to change these numbers. So this will be probably more important for you when we get to the next ALM study and you're choosing between alternate investment portfolios. Some portfolios will perhaps bring down this risk of falling below 50%, but will, on the flip side, likely cost the employers a little bit more. Next slide. Now, over the next 10 years, let's say, while we expect to earn 6.8% on our investments, the likelihood is that we'll earn something a little bit less or a little bit more. What we're modeling here is both a projection of funded status and employer contributions using either a 5.8 or 7.8% return assumption as our brackets. And you can see, first of all, as I said before, even with the 5% return, we still do see improvements in the funded status each year on the left side of the chart, just not as fast as if we get the 6.8 or 7.8 would give us even faster improvement. Contribution projections on the right show us that because of the way we smooth the impact of investment gains and losses, the impact on contributions starts out at a slower pace than the impact on the funded status. And that's just to, first of all, allow our employers to adjust to higher contributions and also give some time for correction in the market. For example, if we have 1 year of really bad return, rather than charge the employers fully for the impact of that return, it gives a little bit of a period for there to be a correction in the market. And if we move to the next slide, we see that even more significantly, where now here we're modeling 1 year worth of really good or really bad investment performance. Our range here, let's see, is 29.2% on the high end versus minus 15.6% on the low end. And these are not likely returns for any particular year, but they're not impossible. In fact, in 2008, we saw something worse than this minus 15.6%. So the theme of this chart is that we can see a pretty large swing in our funded status even in a single year. It does take longer for the contribution requirements to deviate based on that return because of the 5-year smoothing. But if we don't get some correction within that 5 years, you can see that the range of contribution results, even for that 1 year of either good or bad performance, we can end up 5 years later with substantially different employer contributions. Next slide. So in terms of factors that can mitigate risk that have been used and we continue to use, we already mentioned additional contributions made by our employers. This is a chart that represents additional contributions by just our public agencies, so this does not include additional contributions made by the state. You can see there were a few years there where we received $3 billion or more of additional contributions, which was great. A lot of those were due to pension obligation bonds that were very popular during that time period due to low interest rates. We saw a big drop-off in the last year. Of course, pension obligation bonds are not nearly as attractive, and I think to the extent employers had extra money over the last few years, they spent a lot of it in those preceding 3 years. But we are constantly educating our employers of the benefits of making these additional payments. Next slide. So this is just a quick summary of some things we've already talked about that help to manage the risk of the system, the PEPR changes, and I like to think of, managing a large system like this. There's no silver bullet, no one thing that makes this easy or fine necessarily. It's more as if you need a quiver of multiple arrows that you use to attack this problem. And each one of these things listed here is an arrow that has had some benefit to the system, and if you shoot enough arrows, you start to look a lot better. So PEPR changes was one thing that reduced costs a little bit. The improvements in the amortization policy are requiring employers to close that funding gap a little bit faster. Lots of additional discretionary payments. Also, in addition to those payments that are made directly to CalPERS, a lot of our employers are realizing that to put money aside in a Section 115 trust is also a good, potentially for them, based on their circumstances, a good strategy to creating a rainy day fund in the case of a year where the contribution requirement perhaps is outside of what they had budgeted for. The CalPERS Actuarial Office, as well as other folks around CalPERS, try to get out and talk to our employers about these things. There are lots of forums where we speak. We do individual consults with employers. Some of them are listed here. We also have some nice tools that I know you are all familiar with, the Pension Outlook tool in particular. We have a new item on our website. It's the last bullet here, and I'm not going to talk about it, but I would encourage you to, there's a link to that site in the report, and it does show funded status results for all of the plans in the system, and you can choose which groups of plans you want to look at, and it will show you a dot for each one of those plans. It's nice to compare results of our individual plans. And then finally, on the last slide, just some things to continue to be aware of. I think, you know, the item that we have some control over that potentially has the biggest impact on the system is this idea of the balance between risk and reward. Of course, we would like to get the highest returns possible, but generally to do that, we have to take on a little bit more risk. And so the decision of where to draw that line, which is your decision, is a very difficult one. There might be another portfolio introduced to you next March that was talked about yesterday. And beyond that, at the next ALM cycle, you'll certainly have a grouping of portfolios to select from, and that's a very difficult decision. We've got possible near-term economic turmoil. I know the investment office yesterday had kind of a rosier picture of the future than maybe a few months ago when we put this slide together. I think there still are some warning signs that indicate that maybe the returns might not be 6.8% in the near term. It's just something for us to keep an eye on. And then finally, in terms of climate change, we added this mostly because we've seen the great work that our investment office is doing on modeling different scenarios related to climate risk. The actuaries are just starting to talk about various scenarios that might impact mortality or disability, things like that. But we're a little bit behind the investment office folks, and we'll just watch with you what they come up with as far as that kind of research. So with that, we'll take any questions.
Great. So we do have some questions, and I want to start with Mr. Pacheco.
First of all, Brandon, thank you for your presentation. I appreciate the thoroughness again on the PowerPoint. My first question is regarding the more of a bigger picture, economic picture. You know, in your report, you said if we continue to have persistent inflation and near-term economic decline, we may have further increases in employer contribution. What about geopolitical factors as well? Is that also an area of concern that we should be aware of?
Yeah, I'm not sure it's as much of an actuarial question as just how individuals feel about geopolitical concerns. They're there, and to the extent they cause economic turmoil, of course, it's something that we have to keep an eye on, and that will factor its way into the valuations as it occurs. We don't have any particular crystal ball forecast of what those impacts could look like. But to mention, or to respond to your point about inflation, there is some information in the report about cost of living adjustments that are likely to be a little bit higher this year, and we have to wait and see when inflation will drop back down, if ever, back to that 2% target that we saw for so long.
Right, and we're looking at, or we're monitoring that. I mean, I think today, for instance, they came out with it was cooling down. The inflation rate cooled down today. It was reported out today. Yeah. And the next question I have is regarding the Section 115, the trust, the pre-funded trust. I know that at the educational forum there was it seemed to be a lot of interest in that, and I'm wondering what is have been our communication process in terms of outreach, getting more employers to understand our system and the benefits of it, and if you guys can, someone could elaborate on the public agency side on that.
Yeah, I'll start. I don't know if other people want to. Michelle probably wants to chime in. Actually, the actuarial office does not, as much as other departments within CalPERS, operate the SEPT, which is our version of the 115 trust. I believe there was $175 million in the SEPT recently. So that's the amount of money that employers have given to us to invest in those accounts. But of course, our employers use other third-party providers, and we don't really know how much money is in those. I know that the team under Michelle does a lot of outreach to employers, and I'll turn it over to her for more comments.
Thanks, Randy. So our contract and pre-funding trust teams go out to the employers. They participate in webinars. They participate in conferences, so they have set up booths to get the word out, as well as marketing materials, and they just meet with anyone and everyone that they can. They respond to RFPs as they come onto the street, so they keep track of all of that and try to do outreach.
And has it been successful over since I think it started in 2019, right? Or?
Yes, it is growing.
It is growing, and from the. And I think you mentioned that how much has it grown since, let's say, from last year to this year? How many have we got additional employers?
Oh, off the top of my head, let me see if I know somebody that can tell me that. Hold on. You go with me, Drew? They don't know off the top of their head,
That's
but
okay.
we're happy to get back with that.
Oh, that'd be fantastic then. Thank you very much.
The information that was provided to us for this report by Michelle's team, and that information is a little bit in the past right now, but there were 94 employers with $175 million of assets.
Fantastic then. So it is growing then. Thank you. Thank you very much for that information.
Ms. Taylor.
Thank you very much.
You should be on.
Oh, I'm on. There you go. So I have a couple of questions. So as we were getting into the risks, achieving the long-term return, and we talked about the 20-year amortization. So is there a possibility that we could look over our risk policy for the next time around?
Looks like the chief actuary wants to take that question.
Thank you.
Sure. I assume you're referring to the funding risk mitigation policy?
Correct. Thank you very much.
So I think that's a fairly old policy. I think it was implemented, I think, close to the time you first joined the board, Ms. Taylor.
2015.
Yeah, and I think most of the current members aren't familiar with it, so I think we can go ahead and bring that policy back for review. It's probably somewhat outdated, and then we can make some recommendations on how the board wants to proceed with that policy, and then we can go from there on that.
Thank you, Mr. Toronto. I appreciate it. So I think what I'm looking at particularly was the buy down. So when we do very well, then we buy down, take half of that and buy that down. And I'm wondering, since our employers already have to pay half the normal cost when we have a bad year, why should we, I know it's not as much, but they still have to contribute a little more even when we have a good year because we buy those rates down. So maybe
I think it's like you said, we haven't brought that policy back in a number of years. So I think it's definitely worth bringing it back, having a discussion, and seeing whether it's something we want to continue or what we want to do going forward with that policy. So that's not a problem.
And then, and I forgot to bring this up in the investment committee, so never mind. I just had a question on, as we are, I'm trying to find the slide, hold on. Here we go. So as we are going further into PEPRA, right, and we're seeing, and we're going to cross that divide, and we should be seeing a better funding status. How long, and it looks like it's actually about 7 or 8 years before we start seeing a return that makes us sort of 100% funded or close to. Is that something that is a projection? Is that where we think that PEPRA is taking us for real, or are we, as long as markets are winning?
Yeah, so the savings that the employers get from PEPRA results from the fact that the PEPRA benefit packages are a little bit less costly. Now, when they hire a PEPRA person, they immediately start pre-funding that person's benefits. So immediately, the contributions they're giving to CalPERS are somewhat lower than if that was a Classic member that they just hired. So we have been getting that reduction in employer contributions from day one, although it started very small, as you can see on slide 6. I don't know if we want to put that slide up. Not slide 6, sorry. Slide 8. So these are real reductions in employer contributions that our employers have seen. It hasn't necessarily improved the funded status. It's simply lowered the contributions. Now, to the extent that freed up additional cash that they could then use for an additional discretionary payment, that could then boost the funded status. So we're expecting every year for that offset to employer contributions to increase until the point where everybody's a PEPRA member, and then we'll sort of have this locked-in savings from that point forward.
And we're at 60%, you guys said, right?
60% right now, going to about 85% over the next 10 years, based on our actuarial assumptions.
Okay, and that is actually what's making this look better, not necessarily funding status, but employer contribution rate.
That's right.
Okay. All right, thank you.
Thank you. It's an outstanding report. A couple of questions I would like to follow up, and let me pick up on the PEPRA issues that were presented. And this is more commentary than question, but as we are in this 60% of members being PEPRA, there's certainly going to be an increase in tension between those who are Classic employees and those who are PEPRA employees, and that is appearing in different wage negotiations that are taking place among public employers. And it's not so much your responsibility as actuaries, but we need to do a very good job of making clear to everyone what these savings are, where they're evident, and what the impacts of any changes to these PEPRA rules would mean for the system. So,
yeah, and you're correct. We don't drive changes up or down to benefit provisions. However, should anything be presented, we will likely present actuarial information to base decisions on.
Okay. So as I was looking through these charts, one of the questions that emerged is what impact wage growth is going to have on these projections. We have certainly seen, both in the private and the public sector, that employees have been demanding more wage increases, and given inflationary rates, that's absolutely expected, and they are largely receiving significantly better wage contracts than existed in the last 10 years.
Yeah, you're correct, particularly due to the high inflation that we've seen over the last several years. We do expect there to be similar increases in wages, maybe not occurring as quickly as the actual increases in inflation. We did in our last valuation, which was as of June 30, 2022, we saw that in general, pays increase more than our actuarial assumptions, resulted in somewhere around a 1% increase in our accrued liabilities overall. So while we did see that wages increased higher than expected, it wasn't a really large change to our accrued liabilities. Now, should that continue, and there is a good reason to think that it might for the next several years, We would get that information annually as those higher wages are reported. They would come through as actuarial losses, which would have the same impact, although not to the same degree as an investment loss. They would somewhat reduce the funded status, somewhat increase contributions. Probably not as much as a percentage of pay, because the pay is going to be going up, but as a dollar amount, yeah, the dollar contributions would go up as a result of that.
Right. So I would certainly like for us to be monitoring that as it's moving forward to see. And again, if I followed correctly, we're going to see that first in terms of funded status not improving at the rate that we were expecting it to improve. And resulting from that is an increase in employer contribution rates that could result.
That's correct.
All right, thank you.
Yeah, and if I could just add a quick comment to that, we'll be doing the experience study in 2 years, so we'll have 2 more years of data to review, and if we continue to see trends in terms of continued salary increases over our expectation, we'll take that in consideration on setting long-term assumptions. Right now, we're seeing some losses on, as Randy mentioned, losses on the salaries, as increases are higher. The question is are these increases going to be continuing year after year after year, or is it going to be a 1 or 2 year increase and then things start to level out going forward?
Thank you. That helps. Ms. Nix, at the end of her report, had a slide on benefit payments and contributions income, and I think there's, if I follow correctly, a slide in yours that's picking up on essentially the same kind of data. And what both seem to be indicating is for the next decade, you're projecting a pretty normalized rate of increase in terms of benefit payments that we are going to need to make. It's clearly going up each year, but I'm not seeing anything that looks like a dramatic increase in the rate of growth. Is there anything out there that will cause you concern in terms of what that rate of growth in benefit payments are going to be?
Generally, no, and the rate of growth will be a little dampened by PEPRA, as the new retirees are subject to the PEPRA benefits. But this is the nature of a defined benefit retirement system. This kind of, particularly while the system's maturing, I think someone mentioned previously that as the system matures, we see larger increases in those annual benefit payments that tend to moderate as the system becomes fully mature. But even at that point, we would still expect moderate increases year by year. And it's the whole reason we pre-fund, because we know those payments are going to be very high in the future. We don't see any reason for concern on the size of those.
So that goes to the question of the strength of our liquidity and the strength of our cash flow. And there are a few things that, from my perspective, are more critical than we remain strong in those areas. Are there any actions at this point that you think we need to be taking that are different from what we have today in order to ensure that we are maintaining the liquidity that we need?
I can start. It looks like Scott might want to chime in as well. So the question gets a little bit outside of the actuary's knowledge base, which is why we work very closely with our investment office on these kinds of projections. This information, and it's actually slide 6, if we want to put it up. This information gets provided to our investment professionals every year. They make it even fancier and maybe look at some of the investment income, some of the pieces that might be cash versus appreciation, whatever they do with it, and then they do the liquidity analysis and assessment really without us. That's really mostly on them. I know that they do that and they talk to us about that. I'm not hearing any concerns they have about being able to make these benefit payments.
Right. So I think that exhausts my questions, but I want to thank you not only for the report, but for all of the outreach that we are doing to make certain that financial officers, municipal county officials are aware of the direction that we are going and really honing in on the impact that PEPRA is going to have over the next decade in terms of cost savings. I rarely encounter a fellow city council member who's quite understanding of the fact that there is actually improvement on the way. Yeah.
Thank you. Yeah, I was going to say, you just look at the graph that Randy talked about, PEPRA savings. It took 10 years to get those savings, and it started as a trickle, and it's starting to grow, and we anticipate the increases to be a lot more substantial and noticeable going forward.
We have Mr. Rubicava.
It's a very good report. One thing, sometimes people just look at one chart or one fact, and so I want to make sure that people understand the whole balance. Like, for example, on page 4 of 14, we project that employer contribution rates will go up for the next 5 years, but as reflected, which is true, but as reflected also on chart on page 10, it doesn't really lay it out as much, but after those 5 years, we can expect employer contributions to decrease. That's the funny, because one, increase of the PEPRA population versus the classic members, but also because we're paying off the unfunded accrued liability. And that's another element of the way we fund, is that while there is going to be the market fluctuation, the employers sort of protect a little bit, because there's a smoothing, the 5 year before you actually hit the whole impact of the investment return, either whether it's positive or negative. So I think that's another protection we have for the employer. So I think the other takeaway is that, yes, there'll be a little bit a ramp up, but in the long term, which is not that far away, we're going to see a better funded program and employer contributions decreasing. And just to follow up on what the chairman mentioned, is employers are very well, one thing to appreciate, I hope, is that they can budget. They can, everything's not that, not too many surprises. It can be projected more or less. Anyway, thank you.
Thank you.
Thank you. I want to say thank you, because it is a very good report. I would suggest in the future maybe we have another, because it's in your report, it's in the written report, but there isn't a chart, I don't think, that really lays out, other than how long-term their contribution rates will increase, but it's more in the investment risk side. So the heading is sort of not alarmist, but it doesn't really speak to that issue about how long-term rates will decrease for the employer and the funding ratio will improve. So thank you very much.
Thank you. Appreciate the feedback.
Ms. Ortega.
I had a question kind of related to Mr. Rubalcava's question, or the slides he was looking at. On page 4, that graphic there, is it possible to get those lines without the PEPRA savings? Just to see what the percent of, so I'm thinking about the savings as a dollar amount versus where the rates would be without PEPRA. I think that would be helpful for me to see.
Yeah, and I'm trying to think. We have some additional information in the report that's not in the slides. Maybe not exactly what you're asking for, but we have that information and we could put that together.
Okay.
Yes.
I think that would be helpful. I mean, I think the savings is, I mean, it's extremely important, and I recognize everything that's been said about the employers having those savings. But at the same time, when you look at the rate, the way I think about it is, for like every one person, we're paying this percentage of cost in addition just for the pension contribution. So when you look at the safety individuals, that's a pretty significant cost still to the employer. For every one safety person, you might be paying another 60%, almost another full cost of a person just for the pension liability. So I think seeing the difference in what that would be and thinking about how that's going to get better over time in terms of being able to perhaps afford other staffing or just other compensation items.
Yeah, I think we can put something together for you. And by the way, if you're familiar with our tool Pension Outlook, you can do a 30-year projection on any plan or on the system, which does take into account the increase going forward of more and more PEPR members coming into the system.
Right.
Thank you.
Are you looking for state plans in specific, or
I mean, I'd like to see the whole chart if possible. Just
okay.
I think it's helpful for the
for everybody.
All
right.
For a board member perspective to see all of them.
I'd like to second that. That will be a very helpful report.
All right.
So thank you. Mr. Miller?
Yeah, I also think that'll be very helpful in terms of being able to understand the whole picture. And it also reminds me that all those cost savings to our employers, it's all money that comes straight out of the pockets of retirees. And that it's a trade-off when you go to a diminished, when we've got two tiers of retirees, aside from the generational differences in the workplace and at the bargaining table and everywhere else. And in some sense, we hear lots and lots, almost every time we have a board meeting, about, wow, we've got vacancies like crazy. Oh, it's so hard to hire the talent we need in hard to fill positions like accounting and actuarial and IT. And oh, it's tough because we got to look now, inflation, and the employers are going to have to pay more to even, but I would suggest that we may have done ourselves a disservice, because in the bigger picture, it's more cost effective to compete on the basis of benefits, of pensions, of accessible, high-quality health care than it is on trying to compete for talent on a cash basis for public employees. And so, to some extent, I think in the long run, when we see this, I don't view it as all happy and roses, that it's our costs are going down on the benefit side for employers, unless we're not making it up on the employee side or on the retiree side. And so I just want to bring a little bit of a different perspective on it, that when we talk about reducing costs, great. If you're reducing costs by efficiencies, whether operational or economic, or versus by reducing total compensation and benefits, that may not always be the rosy overall picture that we wanted in the grand scheme of things.
Thank you. Are there any other questions or comments from the board? Seeing none, thank you. This was an information item. We will now move on to 6B, which is the semi-annual health plan financial report from Ms. Song.
Good afternoon, Madam Chair and members of the committee. Emily Zong, CalPERS team member. This is agenda item 6B, semi-annual helpline financial report. This is an information item. This report is provided to the committee twice a year as a part of the monitoring and reporting process for the healthcare fund status. It includes health plan account balances, actuarial reserve amount, and surpluses or deficits that within the health plan sub-account. The semi-annual health plan financial report provides the financial performance for the PPO and HMO plan as of the end of June 2023. HMO fully insured plans such as Kaiser and the association plan are not in the scope of this report. And as a reminder, the healthcare fund reserve policy provide a framework for maintaining the appropriate actual reserve level for the PPO and also for managing surpluses or deficits that accumulate in the PPO and HMO subaccount. In June, I shared with the committee the deficits in the basic PPO subaccount as of the end of December 2022. In the next couple slides, I will give you an update for the basic PPO performance for the first half of 2023. This slide presents the recent healthcare fund performance for the HMO basic and PPO Medicare and basic plan. Before going through the detail, a reminder that the healthcare fund subaccount are used for depositing premium and paying claim and other expenses. For our self-funded PPO plan, they require an actuarially prudent level of reserve that include 3 components. The first component is medical and pharmacy claim liability. This covers the fee-for-service claim that have occurred but not yet reported. And the second component is risk-based capital reserve, which based on an industry standard methodology to cover an expected claim due to major health event, a natural disaster, and other causes. And the last piece of component is administrative reserve, which is to cover the wind-down costs should the health plan suddenly terminate. So in this table, starting with the HMO basic plan, the estimated fund balance at the end of June 2023 was $217 million. The next column shows the HMO basic estimated claim liability of $178 million, with the last column showing the surplus of $39 million. On the PPO side, starting with PPO Medicare, the estimated fund balance at the end of June 2023 was $75 million, with estimated liability and required actual reserve level of $137 million for a deficit of $62 million. The PPO Medicare plan pattern is normally higher in the beginning of the year and decrease later in the year. This is because the plan covered the Medicare deductible for the members. As the deductible satisfied, the medical costs decrease. This annual seasonality pattern, combining with the higher than expected pharmacy costs, are what contribute to the current PPO Medicare deficit. But we anticipate this will improve later in the year as medical costs decrease. So for the PPO basic plan, the estimated fund balance as of the end of June 2023 was $177 million. After including the estimated claim liability and required actual reserve of $533 million, the PPO basic plan have a deficit of $356 million. The overall basic PPO status improved by about $63 million from the end of 2022. So just a reminder, all the figures for PPO deficits are compared to where we should be fully reserved, but not a cash deficit. I'll go through some detail for the basic PPO performance in the next slide. Sorry. Okay, here we go. In June, we reported the basic PPO with a reserve deficit of $437 million as of the end of 2022. As more claim has been processed and more data become available, now the updated deficit is become $419 million at the end of 2022, an $18 million improvement. And for the first half of 2023, there was about $61 million increase in the fund balance due to medical cost seasonality patterns. For the basic PPO plan, they have an opposite seasonality pattern to the PPO Medicare plan. The PPO basic members satisfy their annual deductible earlier in the year. So the medical costs are normally lower in the first half of the year and then increase in the second half of the year. For pharmacy, while we have the best in the market pricing under our current Optum contract, but the high utilization and more use of a high-cost specialty drug contribute to about $28 million loss for the first half of 2023. And for our 2023 PPO basic premium, as we know, we include a surcharge of 2% in platinum and 3% in gold for the purpose of replenishing the healthcare fund reserves. We collected about $27 million in surcharge for the first 6 months of 2023. And there was also a small investment gain of $3 million. The overall basic PPO status improved by, again, about $63 million, bringing the total reserve deficits for the basic PPO to $356 million as of the end of June 2023. In summary, we still anticipate the PPO fund status will continue to improve. With the surcharge included in the basic PPO premium, our goal is to generate additional premium revenue to continue to replenishing the reserve deficits. And we are also currently conducting solicitation for a new 5-year contract for PPO from 2025 to 2029. We will be assessing border changes to the PPO, including potential intervention to curb short-term and long-term costs. That concludes my presentation, and we're happy to take any questions.
Are there any questions from the board? As you have projected out over the next 3 to 5 years, at what point do you expect the deficit to be eliminated?
I believe as we share in the 2024 rate development, so even though now like a few months gone, we're still expecting if we continue the similar surcharge level for the PPO basic plan, it's about 4 years.
4 years. Great, thank you.
And if I could, I think what we're seeing in the first 6 months of this year is a marginal improvement over what was anticipated, primarily on the medical side. You saw the challenging number on the pharmacy side. We're still factoring in the rebate piece of that. So as spending goes up, which as you see it has, rebates correspondingly go up. So that in all likelihood, that will slim a little bit. Medical is looking a little bit better, so that puts us for this year marginally improved over anticipated, but still similar trajectory.
Are there areas that give you substantial concern about being able to make that 4-year projection?
At this point, we don't see any really significant sign that stop us from the 4 years. So that is also given in the new PPO 5-year contract. We will continue with the self-funded model.
Okay, thank you. Seeing no questions from the board, thank you for that report, and we will move on. Thank you. Okay. So with that, we are now to summary of committee direction.
Okay, Madam Chair, I'd like to address Jose's question about the growth in the SEPT for the last year. Before I do that, 72, at the end of last year, there were 72 employers, and this year we have 94. We had 85 million in assets under management, and we now have 174 million, so it's growing. As far as committee direction goes, I took down 2. The first one was to bring the funding risk mitigation policy back and to actually make sure that we highlight the buy down provision within that. And my second committee direction would be to provide a chart similar to the one on page 4 of the actuarial presentation that lays out the contribution rates without the PEPR savings and project it over time so that we can get a better idea of what the employer rates would be without it.
All right, thank you.
And
Mr. Pacheco?
Yes, Ms. Nix, I just want to thank you for that information, and I want to also thank your team on this. I really believe that the Section 115 trust pre-funding for the pension is an excellent tool to be utilized by the employers if they are able to do so, and to be able to mitigate risk in the entire system. So thank you for that update, and keep up the good work. Thank you.
Thank you. And if you have any employers out there that would like us to come and talk to them, please pass that our way. We'll be happy to do so.
Thank you. Definitely. Thank you.
I have not received any requests for public comment. All right. Then we are adjourned. The next meeting on our calendar is the Governance Committee. We will take a 10-minute break, so back at 3:20 for the Governance Committee. Thank you all.
Very well. Good afternoon, President Taylor and board members. Very exhaustive agenda this afternoon, so I hope everybody's got well fueled for a long meeting. I don't have any fancy PowerPoints, and I am going to try and set a record for the shortest meeting. So really all we have on the agenda is the schedule for board meetings for next year, board and committee meetings for next year. That is on the consent calendar. So if there's no concerns about that, I think this meeting will go pretty quickly. I would just note that in January, Travis Antonioni will be coming back with the results of the board's self-evaluation survey, and there will be discussion at that point about next steps. That will probably be at the full board meeting rather than governance, but that's to be determined. And that is my report.
Thank you, Mr. Jacobs. So moving on to action consent items 3, being moved by Mr. Miller, seconded by Ms. Ortega. All those in favor?
Aye.
All those opposed? Any abstentions? Motion passes. And then we move on to the information consent items. Before we move through that, I just want to make sure that I address one of our stakeholders. We have the ability to have more committee meetings if necessary. We did have 2 ad hoc committee meetings last year. They didn't appear on the, not ad hoc, but we had 2 extra investment committee meetings. They didn't appear on the calendar. So we ended up with 6 meetings last year. And I think we do almost every year for investment committee. So with that, I had not received anything asking me to pull any items from the information consent items. So we're going to move forward on that. Do I have any information agenda items, which I do not? I have summary of committee direction next.
I did not note any direction.
Does anybody want to make public comment? I have no request to make public comment. Well, that was the fastest meeting ever. This meeting of the Board Governance Committee is adjourned. Thank you very much. We will see each other in the morning at 9 a.m. Thank you.
Well done.